been interesting watching how that plays out.
All righty, we're live now, so I'm going to welcome everyone to the Tuesday, August 11th, 2020 Radnor Township School District Special Board Meeting. To provide an update on our reopening plans, I'm going to call the meeting to order with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to report that the board met in executive session earlier today, and I'll get right underway. I don't know that we really have a report from the superintendent, but I'd like to welcome Dr. David Rubin and Dr. PJ Brennan to our meeting tonight. And later we'll be hearing from our new Radnor Township Education Association President, Rob King. So a welcome to him when he sends his remarks. Mr. Batchelor, if you want to get going, thank you.
Thank you. I want to thank Dr. Rubin and Dr. Brennan for not only joining us tonight, but thank both of them for the guidance that they have been providing to school districts and the time that they have given to help us in this time. And I know how busy that they have been, and they've made time not only to attend board meetings, but to meet with superintendents and to provide us guidance and insight into not only opening schools, but also information about the virus, dealing with students, and we just really appreciative of all the guidance. So Dr. Rubin is the director of the Policy Lab, director of Population Health Innovation at Children's Hospital of Philadelphia. Dr. Brennan is chief medical officer and senior vice president of the University of Pennsylvania Health Systems, board certified in infectious disease and internal medicine. We only have him for a short while, so I'll just kick it off with questions I collected today from some of the board members. If you could, both of you have been giving us guidance over the last few weeks, could share some of your guidance and factors that school districts should be considering when looking to reopen schools in the fall.
Well, Dr. Batchelor, I'll jump in first and let David follow, and I'll be brief. There are some metrics that I think we should be following, but I think it's particularly important that we follow the trajectory of these metrics as well, not the absolute numbers. So we're interested in the test positivity rate. We're interested in the trends in the 7-day and 14-day averages, and we're interested in the absolute number of cases that we're seeing in the county. As we think about these numbers, they have been up and down over the what I'll refer to as the tail end of this part of the pandemic. By no means are we in a place where we were in March and April, but I thought we would be in a better place in June than we are today. So our test positivity rate is over 5% at this point in time, but over the last week or 10 days, it appears to be trending down in the county. Some of the concerns that I've had relate to the activities at the end of the summer, as we saw after the 4th of July weekend, and how those caused an uptick in cases. And I think it's particularly important to keep all this in mind as you think about the runway that you have to reopening the schools and the need to make decisions in a timely fashion that give you enough time to prepare. So the recommendations that I've made have related to those considerations and the need, I think, to buy time and be sure that we're in the safest place possible. We're in a safer place, not necessarily the safest place, but the safer place as we enter September. So I'll stop there and let David have the microphone.
Sure, I'm just taking a look. Actually, I realized that right before this call, I actually just got a sneak peek at our models this week, and so I think it confirms what I'm going to be saying to you. I just want to just take a quick peek at they literally just arrived, and for me, it just confirms where we are, which is that when I think since this is the first time I've spoken to the group here. In terms of, in Radnor, I just want to talk a little bit about this. Oh, am I on? No, I'm not on mute. But I want to talk a little bit about the assumptions of what we know about kids first and what leads to these recommendations. Number one is we've had emerging evidence over the summer that, right now we know that the kids they're less susceptible to severe infection than adults. Doesn't mean they don't get it. I want to be cautious in that because that data is relevant to a time when schools were closed. And we've actually seen an increase in at least cases being identified among kids and adolescents in the latter half of July. That was just reported by the American Academy of Pediatrics. I still believe they're less susceptible to severe infection, but they are at risk for severe infection. But mostly we do this is because the kids themselves, I think there's increasing evidence that symptomatic children will transmit this virus, and potentially even pre-symptomatic kids and certainly adolescents in the day or two before they're symptomatic. And you can expect that at higher incidence of disease in the community, that you're going to see transmission. We've been through 3 chapters in this country in terms of what this virus likes to do. It likes to spread in environments where people gather, certainly indoors. We saw that with the higher risk patients in institutional settings like nursing homes. We saw it in meatpacking facilities, which weren't just hospitable to viral growth because they were cold and damp, but they also largely involve migrant workers who live in residential facilities and congregate facilities. We've now seen it in summer over the Memorial Day and July 4th holidays and beyond, with large gatherings, people not wearing masks, etc. So travel and vacation became the chapter 3. And if you think towards the fall and you think about where are those pockets where we haven't seen as much infection and where we gather in the fall, is at universities and schools. The evidence out of Israel with an outbreak in Israel was pretty substantial in our thinking at CHOP, as were camp outbreaks in Missouri and Georgia. And just this week, the farce that played out in Gwinnett County, Georgia, where they tried to reopen schools, identified 260 staff with infections on day 1 and have already closed their schools because of infections that they've identified. Gwinnett County, for those of you who don't know, is outside Atlanta, has had surging infections, well beyond what anyone on this call would consider safe to reopen schools. But I think you learn from these events because you learn that if there is high community incidence, this virus is going to spread, and we can expect that schools can be a place in which outbreaks can originate in communities. The teachers certainly are at risk, the families are at risk, the wider community is at risk from outbreaks. I just reviewed the models. I've been reviewing them all day. I'm already seeing outbreaks in university environments. We're seeing outbreaks at the University of Georgia. We're seeing outbreaks at the University of Alabama. And I can list a number of college campuses where we're already seeing these outbreaks. So we should accept that that at higher community incidence, we're going to see transmission. So what I would say, and sorry for my dog in the background there, but what I would say is, based on that, we have become more and more cautious at CHOP and urging, and certainly in our deliberations with the state, that we think about this as learning from the mistakes in April and May, where many areas of the country opened too quickly and not cautiously enough, and it burned them. And we're now playing that out because the pressure to open schools is real. Like, these kids need to be in school. In-school learning is extremely important for many reasons, not workforce participation, socio-emotionally for kids, for their education. There are kids that cannot learn well virtually, particularly our kids in special education and our elementary school kids. I think it's very difficult for them, and we acknowledge that. But what metrics should you use based on what we're seeing? Well, what we're recommending, and this is similar to what the state recommended this week, but maybe even a little bit more conservative. Number one, we'd like to get closer to European thresholds in terms of reopening. Now, they didn't reopen their communities until they were less than 1 per 100,000 per day, which is about 7 per 100 per 1,000 per week. Let's say 10, if we round up and we're trying to be ambitious, 10 per 100,000 per week. Well, Delaware County in particular has been averaging 10 to 12 per 100 per 1,000 per day. And there was some evidence last week that maybe Delaware County was starting to improve a little last week. I'm not convinced this week. If anything, they look a little worse this week. They're about the same. They're just kind of smoldering. as is Montgomery County, which actually looks a little worse. And I think that's relevant to you all in Radnor, to see to see Montgomery County getting a little worse and Philadelphia not really making a substantial improvement this week. Testing positivity hovers around 5% and above in Delaware County. What you'd like to be, ideally, you'd like to see sort of fewer than 10 per 100 per 1,000 per week. You'd like to see testing positivity at least below 5% declining. You'd like to see your weekly case incidence declining. I would like to see even in test positivity below 3%. New York's considering reopening at less than 1% or around 1%. They've really created the environment to try to reopen schools in the New York City area, even though there's potential risk there as New Jersey starts to worsen as well. The added factor beyond the sort of stable or declining daily or weekly incidents and the testing positivity would be the fact that Labor Day has not happened yet. And we've already seen Memorial Day and July 4th. And I believe, my assumption is that Americans and particularly folks in the region are going to flood to the shore for that last blast of summer. And so you're potentially opening in a very dicey environment, even if there's some mild improvements, with a Labor Day that brings uncertain risk as kids return to school that week. And so for that, I think Dr. Brennan and I were in agreement. I think there may be a window that opens up as people stop traveling. Maybe they hunker down a little bit. And we start to get some improvements, hopefully by mid-September. We don't see a big surge after Labor Day, that you might get a window in early October to get your schools open for in-school learning. Now, I have, Ken Batchelor, you contacted me. Radnor is a bit of a bubble within Delaware County, as is Wallingford and Strathaven, right? That district as well too. I suspect your positivity rates are a little bit lower, so we should get that out in the open. But again, this is about where parents work, the conferred risk to kids. I think if you're hedging and you're going to make the bet on your own positivity rates and your own community transmission being lower, I suggested to Ken that maybe you contact the DOH and see if you can get a little bit more refined positivity data in your zip codes. Maybe that can help a little bit. Maybe you'll find out that your positivity rate is 2%. Maybe that might make you think, well, can we open anything for in-school learning? If I were to prioritize, if you wanted to hedge, if I were to prioritize any populations for in-school on Labor Day, it would be your special ed kids who can't learn virtually. And it might be your early elementary school age kids who are also going to have challenges, but also are known to be less susceptible to infection. But you got to remember, if your rates are higher enough in the community and you have an outbreak with those kids, you're going to be throwing the October 2nd deadline. So these are difficult judgments. You have a lot of permutations that you can consider, but all told, with everything that I see now, and now having seen the models today, which will be out on our website at policylab.chop.edu tomorrow, my inclination, my gut feeling, if you ask me for a recommendation, would be to hold till October, to the beginning of October, reassess in mid-September, have a little more certainty as to where rates are going in the Philadelphia region at that point. And hopefully, if we're lucky, and that we'll see degrading case counts, and I'm not yet certain about that.
So looking at the state data then, or the state metric that we've then received, and you're looking at that metric, you're proposing something more conservative than that metric that we're seeing, and that incident rate where we're at as Delaware County is a 78.6. You're suggesting we'd want to see it down closer to 10. Okay. And what would be the threshold then, if we started virtual, what would be the threshold then to open school? What would we be looking then for a threshold to open?
I'd like to, I think if it's also about a pathway to success. It's a pathway to sustain success, because in 2 weeks, if you open too high and you have an outbreak within 2 weeks, you're going to be very quickly having very challenging decisions to close schools. And when you close schools, it's not 2 days like Gwinnett County. Wiping the desk down and when you have a significant outbreak in a school is not doing anything, when there's an outbreak. You're closing for at least 14 to 28 days, whether it's a school or a district, because you need to go through a couple transmission cycles in quarantine. And so it's a substantial, it's a big, to me, opening schools it in some ways is going to be easier closing them down, and whether you're going to get them back open after that, to me, has got to be in your calculus here. And so I'd like to see you kind of create a pathway to success. Be confident that you're as close to 10 per 100,000 and maybe even lower and declining. Your test positivity is well south of 5%. That you're convinced that Labor Day did not confer additional risk. And then I think that you'll be safe to reopen broadly, whether you're doing a hybrid or a full school plan. That to me, the hybrid or full school plan was always about the 6-foot distancing and classroom and depopulating classrooms. Some of our private schools were able to do that with all their kids there. But most of our public schools have had to go to a hybrid schedule. If you're in the, in between, I left room to kind of think about those special ed kids, like I talked about, in the elementary school kids, if you're sort of on the fence. But my gut feeling is you want to wait to get these numbers down. It's similar into the spring when New York waited longer than everyone else to reopen. You've seen the benefits of that as they continue to beat the rest of the nation in terms of their counts throughout the New York region. Some of that's enforcement as well too.
And one thing I would say is that the experience, with the exception of New York, has been that whether you open up early or late, you see a rebound in cases, and it's happened all across the country. In the southern states where they weren't closed for very long and they opened too soon, we saw a really, really dramatic increase. But even states like Massachusetts and New Jersey and southeastern Pennsylvania, all of which have done well, have seen a rebound as social distancing decreased and more non-essential business use increased. Cases went in the wrong direction.
So looking at one of the other questions we had, and I think you just answered it in many ways, but looking at what we have in Delaware County right now and the challenge of drilling down, I did reach out to the health department today to try to drill down to our positivity specific to Radnor, and we don't have that data right now. And the health department is going to try to help us to gather that data. But looking at it right now, when you recommend virtual start, what about the idea of a K2, looking at different metrics for different ages? I mean, would starting a K2 band right now with these metrics still be something you recommend holding off to October? Or is that something that you see that we could try to do as just bring in the kindergartners to second grade for 2 or 3 weeks?
I think that's where you got a little bit of a hedge there, because I think that you can make strong arguments in favor of the K-2. I would like, to me, I'd like to see your Radnor data. If you find out that your testing positivity has been fairly stable at 2% or lower, and you can convince yourself that the risk and for community spread is much lower, then you can test out your protocols in the K-2. Those kids are going to be less susceptible to infection. I think that it is a judgment call. There is no bright line. I mean, there's no answer here that gives you no risk. But I understand the permutation about the early elementary school kids. And so I think that's one that I defer to the district, is how much risk do you want to take? Because it could go sideways on you as you try to get ready to bring more kids in, or it could be an opportunity to test your protocols with the younger kids who are less susceptible, who are also less susceptible to the MISC infection, that severe infection in kids. Then some of the age range for that includes some of those kids, but we've seen older kids with that inflammatory syndrome. To me, that's right in that sort of the zone where you're not sure. But I would remind you that the rates in the Philadelphia region are pretty tenuous right now.
And I'll give you some data, and this is not necessarily representative of the population in Radnor Township, but as you probably know, at our Penn Medicine facility on King of Prussia Road, we've been doing drive-through testing since March, and over the last 4 weeks, the test positivity rate from that site has been 3, 2, and 1%. So not a representative sample necessarily. These are people that are self-selecting to come in and be tested, but they're probably at somewhat higher risk because they're thinking they they have a reason to be tested. But to what David is speaking to, your township is probably in a somewhat better place, but the health department will have more complete data for you.
Mhm. So you do have a little bit, you have some room to maneuver, Ken. The question is, do you want to take that, or do you want to be really conservative and drive your counts down even further? But I can see some permutations that a place like Radnor or Lower Merion or Wallingford might have considered, if they had convincing data that things were a little bit more stable in their communities than they were elsewhere. But I'm just cognizant of the fact when it gets colder and if we have transmission, it's going to be harder to keep these schools open. I'm just sort of balancing both ends of the spectrum.
How will the, I was just going to say, how will the colleges affect us? Some of the colleges, some of them in our actually right in Radnor are coming back at the end of this week.
Yeah.
Is that going to create a problem for us if we hold off? How does that impact us with their case counts?
Yeah, Ken, let me jump in on that. I think the students returning to colleges are going to be a real issue. You probably you may not know, but Penn announced today that we're not going to bring students back to campus to residential living. When you have colleges that are bringing students back from all over the country, and Villanova's population isn't perhaps as far-flung as some other larger universities, but still they're coming from a fairly wide geographic area. And just, frankly, the activities that college students will engage in, creates a real hazard in the community. And that's why I think it's so important that colleges try to have robust testing programs. So I think, the influx of students there will be a challenge to introduce more disease, more infection into the community, and then their behaviors after arriving, frankly, will do the same.
So there are two factors that we didn't talk about. One is the colleges. I mean, this came up in Swarthmore as well too. I think that's a real concern. It's another reason that would go into the calculus of waiting until mid-September rather than rushing kids back in the classroom to see what happens. The other one is testing capacity. I was just on a call with PDE. I've been working on, I've been actually providing some advice to the K-12 task force for the state. And, there's most superintendents, how are you going to treat a symptomatic kid in the classroom right now if you don't have tests that are going to turn around within a few hours? Who's being quarantined? I mean, these are really difficult, challenging decisions. We do not have the testing availability in terms of the turnaround to make rapid decisions in these schools yet. We had hoped that the rapid antigen test, which is the quickest test, would be reliable and available by, I'm hearing early October. I'm not even sure about that. So it puts schools in a very challenging situation when that kid in school develops a cough and a sore throat and goes to the nurse's office. What are you going to do? Well, conservatively, if that kid can't get tested or doesn't go to CHOP to get a 4-hour turnaround, you're quarantining the 4 kids around that kid until that test comes back, or you may be just deciding to quarantine 5 kids, right? If you don't have those tests. And then if there's a couple of those kids in the classroom, you're closing down the classroom. And so you start to go down these permutations, and you realize how challenging it's going to be to decide what to do when kids are symptomatic in the absence of tests that come back very quickly. And that adds to another layer. If we had rapid turnaround of tests in the region and you felt like you had access to that, it makes it a little easier. But in the absence of that is another one of those things that goes into the corner of waiting a few more weeks to see if we can get a better protocol in place around symptomatic students.
You both have covered many of our questions. I just have 2 other quick topics. One was mask versus face shields. And there's some studies out there that there was one out, I think, out of a Israeli institute that suggested that there might be some value in a face shield. Any comments or thoughts? We'd initially had a plan that said beyond 6 feet, a student could put on a face shield instead of a face mask. In hearing from our community, they would rather see in discussions with individual board members, see mask at all time. Any thoughts on mask versus face shield? And also a recent study I just saw today out of Duke about the concerns over the buffs, and that the buffs aren't as possibly, as effective and could be actually more problematic.
Yeah, I think, anything that covers the face will provide some degree of protection, Ken. But there's certainly a gradient and still a lot that we don't know. So, bandanas and those sorts of cotton devices are at one extreme, and at the other extreme, you have the N95 respirators that folks use in the hospital. But the uncertainty about face shields is the ability of aerosols to be entrained under the shield itself and be inhaled. So I think there's still more to be learned there. They will certainly prevent droplets from. They will catch droplets that are being expelled, but whether they're effective enough to prevent droplets from being entrained under the mask, under the shield, is another issue. So my preference, and it is a preference, is for masking.
I'll add on my side, as we've talked about this at CHOP, theoretically, if you opened with low community transmission and you had 6-foot distancing between desks, it could provide you opportunities for kids to take the masks off, at least for breaks, when they're sitting at their desks. Parents have worked really hard to reinforce the effective use of masks in their kids, certainly in transition on buses, to and from the bathroom, to and from lunch. In transition, they should all be wearing masks, not face shields. We recommend surgical masks. We prefer them to cloth masks, but any mask is better than no mask. The teachers, we recommend masking, although I have to say, for the first time, I saw a face shield for teachers that I thought was potentially a nice solution that would allow them. It had a neck covering that actually went down with a face shield that had been developed in Alaska, and I just saw that from another physician who sent me the link for this, and I suspected that would be a pretty good shield, PJ. Because of the concern, some people have a lot of concern, and I think it's a reasonable concern that teachers would mask. A lot of kids, particularly kids with special ed needs, or certainly kids with ADHD, probably need those visual cues to see the teachers. But I did see one potential face shield for the teachers that, with a fair amount of distancing, I thought offered them some adequate protection. But masks are always going to be preferable to face shields in general.
Yes, surgical masks have about 80% efficiency in filtering particles, whereas N95s have a 95% efficiency, and the cotton masks are less than the surgical mask, probably in the 60 to 70% range. But I think, as a practical matter, kids are going to have breaks. I know that when I'm walking around in the hospital with a mask on, I can't do it for an hour. I have to pull the mask down from time to time to get a little bit of relief.
If you do good symptom surveillance, if you're really rigorous about keeping symptomatic kids out of the classroom, with your daily symptom surveillance, which is part of your mitigation strategy, and you have those desks 6 feet apart, it gives you ample opportunity to do some masking breaks, I believe. And it's certainly I would calibrate the amount of time you do that to what your community prevalence is. I mean, at times when things are surging, you're trying to keep your schools open, you may try to keep the masks on a little bit longer. If we were lucky enough to get to a point where we're less than 1% positivity, you may be able to spend more time without masks on while they're sitting at their desks.
So without saying it explicitly, Ken, we're talking about the layered set of protective measures, each of which should be executed as fully as possible, starting with screening and making sure that there are no kids with symptoms in school or teachers with symptoms in school, and then masking and distancing and cohorting and good hygiene.
Yep.
I think you hear about as Dr. Rubin was talking about, Gwinnett County, they're going to do a deep cleaning of the school. I mean, the deep cleaning of the school is not the issue. It's having sick kids in school that aren't masking and are too close together.
And our thought was, once kids were seated at a desk 6 feet or beyond, the mask break would be put on a face shield. Either keep the mask on or put on a face shield, and that way the teacher could see their face and the kid could see the student could see the teacher.
Right.
That was our thought with that. So I mean, that is still something that you would agree that might be something, depending on where we are, something we may want to consider at 6 feet.
Yes, I would say so.
Yeah, I hadn't heard that. That's a permutation or variation on some of just trying to reduce the likelihood of the child at the desk spreading to a child around them. It's an interesting variation. I think it seems reasonable. I also worry about enforcement issues in the classroom and distracting from learning. So, I think some of the masking breaks were an effort to try to simplify things for teachers who are focused on learning, and yet, what are you going to do if a kid refuses to wear any of this? And I think that's going to be a challenge for every district.
Yeah. Last question, athletics. I know, Dr. Rubin, you've been doing some things with athletics and some seminars and just insights. Right now we're on hold as a district based on the governor's comment, based on waiting to hear from PIAA, but we do right now have voluntary practices continuing. The board voted last week to put a halt to all of that 2 weeks before school starts. We voted to do that. Just any thoughts on athletics and activities for students? But
Yeah, so I actually,
minor point.
I'm beyond convention here. I don't know if I reflect everyone at CHOP, but I think of everything we're doing as moments of transmission. The reason why we're having a tough time with schools is those poorly ventilated classrooms with lots of kids cohorting in a group. That there are many, and I understand the opinion that say if you can't get schools open, you shouldn't have sports open. It's sort of like this, but it feels almost punitive. To me, you got to work, socio-emotional health of the kids and activities, not just sports, are part of the school environment. And some of those sports and activities don't confer additional risk if done correctly. Certainly, you don't want to do it when your testing positivity is really high, but playing golf, for example, on the golf team, or doing individual drills, or playing tennis with hand hygiene and some distancing, and even softball, the low contact sports like softball and baseball, I'm not sure if managed correctly with strict rules, that we're going to see a lot of transmission out of those. But certainly our sports medicine department is recommending that for all sports, there's no reason to suspend individual drills and distanced practicing. The high contact sports, soccer, lacrosse, football, field hockey, water polo, basketball, there may be a couple other I'm missing. They really cannot have any scrimmaging until you're well into those European numbers. We've just seen too much transmission in those settings. We've even seen it, the Florida Marlins have an outbreak as well too, which might make you a little bit more cautious about doing baseball or softball. But I think, individual drills where kids are distanced, where there are no spectators, where you provide an opportunity. Kids actually, when you look at the Aspen Institute polling, prefer just to see their friends. The parents care about winning. The kids don't care about winning as much as the parents do. They're happy to see their friends. So, I think being a little bit creative around activities, even when you're doing virtual learning, I think there's a little room for that, particularly if you're again in that margin. If you're at, so what we said is, if you're moving up 5, 6, 7, if you're increasing cases, you're probably going to suspend a lot of those activities, try to decrease transmission. But I'm not sure yet that you have to not disallow the tennis team from doing some practicing, or disallow the golf team. I think that we shouldn't be so rigid to not think about moments of transmission and think about what is the conferred risk based on what you're seeing.
I think you also have to consider the training activities, because we know that indoor training sessions have also led to spread. Certainly, some of the summertime college outbreaks that occurred in football teams were related to indoor weight training activities. And I'm aware of a local situation in which weight training resulted in that. I'll also just comment briefly on some of the arts as well. With band, for example, the woodwinds and horns and flutes actually pose a particular hazard in terms of aerosols. I'm not aware of actually any band-related transmissions, but woodwinds create an aerosol that tend to linger in the proximity of the player. and so those around have to be protected in some way. So I think that marching bands are a mixed bag because of being outdoors, but they're also in closer proximity than a concert band might be. And I think we know pretty well that singing is a hazard as well. So choral groups and musicals, given where we are right now, I think are probably not appropriate.
Yeah, I think if you do have them together, I think what I would say, I agree with the wind instruments. I said prepare to train a generation of violinists and cellists. I think it's time, right? And then I said, but small quartets, small singing groups with 6 foot to me is not enough, given that what Dr. Brennan talked about. If you can spread kids out even more and have smaller groups, I think you just have to kind of think about how you're doing that to try to reduce the risk, given some of those elements that you spoke about. The other thing I thought was a nice hedge for most sports, rather than just cancel them. We've seen a lot of elbow and shoulder injuries, particularly as PIAA has really rushed the softball and baseball players back. That given that you may end up watching your numbers into mid-September, kids can't just rush back into team competition and throw 6 or 7 innings. And that's been a huge problem in our sports medicine department. So what I would say is, limit all your sporting activities to training until October, if you're going to do them. And then you can reassess as you're going through September, if you're doing individual distance drills with masks, whether you're going to be able to move to team competition or scrimmages. Radnor's going to play Lower Merion or Harrington. That's it this year, right? And you're going to, or scrimmage within the team, but you may not get to scrimmages, and that's okay. But it gives you a nice way to kind of, if you want to add some activities to get people training in a safe environment, even as you start the school year.
You've given us a ton of time. Last question, I promise this is it. How do we answer parents with where are we going as a country and as a community? Are we trying to completely stop the spread of this? Are we trying to open up schools while this is still going to be in our communities? How do we respond to that? I mean, I know you've given answers to that, but how long do we wind up waiting and with the advice that you've given?
Well, I think that both of us are recommending waiting into September to see where we are. I think the relative risks of the virus versus having students out of school and not developing socio-emotional skills and academic skills at some point will fully outweigh the risk of the virus, unless we're at very high levels of transmission. So I think we'll be in a better position in a month to see where we are and make that decision. But I think that for now we should be trying to get our transmission rates down to a lower level than the current ones. So
I can't emphasize enough what Dr. Brennan said. It all starts with getting transmission rates down. This is a national tragedy. It really is. To that we haven't gotten our case counts down to a sufficient level to open our schools safely. But that doesn't mean we should rush into opening schools because, to take that chance with our families or our teachers. I know the task force, the White House task force with whom I've been in contact, has been working very hard to get governors to standardize their response. We're seeing some improvements in many areas. I still remain somewhat hopeful that as vacation travel subsides and summer moves behind us, and if governors can stay resolute to some of the more sensible restrictions they've now done, like closing bars, keeping restaurant occupancy at limited levels as we move into the fall, certainly universal masking mandates, and limiting gathering sizes, that we can try to get back to a footing where we can get down closer to that 10 per 100,000 per week, where we give ourselves a chance to succeed like Europe has succeeded. And so I don't think that's out of the realm that we could get there. We can be cynical and say we've seen enough to know that America's not going to do it. And then, step 2 is thinking about the vaccine and when is that coming? I think there's very promising early data on the vaccine front. There's a lot of vaccine candidates. I was just on a call last week. I speak to Paul Offit, who's on the advisory council all the time. There are phase 3 trials going on for multiple vaccine candidates. The early data has been promising. I don't think that vaccine or the vaccines plural will even arrive till February, March. And then there's going to be a whole deployment issue. If I were from the school's perspective, and I've raised this with the state, obviously not everyone's going to get it on the first round, but who needs to get it the most? Well, obviously your healthcare professionals, your mass transit workers, and your teachers and your staff in the schools, because if we can protect our teachers and our staff in our schools, and we continue to see a lower risk of symptomatic infection than parents as well, we can start to deploy this in a way that changes the calculus for school districts to take more risks to reopen schools, because the likelihood of spread is going to go down.
Thank you both. I appreciate you making time tonight. I know you've been so busy and volunteering your time to support the school districts, and I really appreciate you being available to us tonight. So thank you so much.
Sure. Our pleasure.
See ya.
Take care.
Dr. Brennan, Dr. Rubin, thank you.
You're welcome.
Yeah.
Good luck.
Thank you.
Thank you both.
All right, Ken. So that was the presentation. And I think before we entertain any board discussion, or there's really no discussion at this point, thank you for asking all those questions on our behalf and for having Dr. Rubin and Dr. Brennan come tonight. But let's get into public comment, and then we can move into the rest of our agenda. Mr. Petiti, I'm hoping that you're ready with some board comment. Citizens are encouraged to address the board during the public comment portions of our meeting. With topics on the agenda or other, well, tonight it's a special meeting, so just topics on our agenda. We ask that when you give your email comment that you give your name and address. Your individual comment should be limited to not more than 4 minutes as per board policy 006. And again, you may submit your board comments to boardcomments@rtsd.org or send them in writing to Mr. Michael Petiti, the Radnor Township School District, 135 South Wayne Avenue, Wayne, Pennsylvania, 19087. Mr. Petiti, we were not able to hear public comment during the finance meeting. So were there any comments that you received tonight that were specific to the finance meeting that we held at 6 o'clock tonight?
Oh, I did not receive any specific to the finance committee meeting, no.
Okay, great. So then why don't you just get underway with public comment? Thank you.
Sure. The first comment, I think we have about 40. The first is, and a quick point of order, Mr. Stern. Do the public comments require the name of the commenter as well as the address to be read aloud during the meeting for the comment to be read aloud?
Yes, the name and the address. Yes. And tonight we're only entertaining comments as they relate to the school reopening plans. So, you may have received emails about other topics, and those would not be applicable for tonight's special board meeting.
Okay, thank you.
Can I just clarify? I think we've said in the past, if you're a student, your address does not need to be read.
Wait, true. If you can read from the comment that it's a student, then yes, please don't give their address.
Okay, thank you. First comment is from Jeffrey Batt, 15 Quintero Road, Wayne. I've been thinking about the things we all try to teach our children. Safety first, be considerate of others, respect the community, help those in need, follow the golden rule. And I wonder what they're going to say to us when they become adults. They hear us say how important they are and how their education is essential, yet they see us open bars, disregard mask wearing orders, and generally fail to contain the spread of COVID so that it would be safe for them to return to school in this fall. They see us emphasize data that purports to show kids are unlikely to develop severe cases of COVID and ignore data that seems to demonstrate long-term cardiac damage in children with mild and asymptomatic cases. They watch as we claim to care about the health and safety of the community, while we all but force bus drivers, custodians, and teachers to risk severe illness and death because we did not take steps this summer to ensure schools are safe to reopen this fall. They listen to us emphasize the importance of STEM while we ignore the warnings of well-credentialed experts and mock science. They are learning that what we teach them about virtue and responsibility are words that our deeds fail to match. What will we say to them when they ask us why we did not live up to our responsibilities at this critical period in their lives? When the time comes, I doubt any of us will have a good answer to that question. From John Dell, 10 Longwood Drive in Wayne, PA. Ladies and gentlemen of the board, I want to thank the 7 of you who chose to strive ahead and forward to help our children. While I hope for full-time 5-day school, I understand the challenges and barriers you face as members of the board who are faced with this hard decision. I am grateful you chose the best option for all parties involved with an eye towards some state of normalcy. Thank you for choosing to lead instead of following. Once again, I am proud to be a Radnor parent. From Dr. Pamela Beaumail, 211 Hermitage Drive. In regards to the athletic health and safety plan, I wanted to say that I think it will be very difficult to return to athletics in any normal capacity under a hybrid model. And as we have seen in the professional sports arena, even one positive case puts an entire team and then other competing teams at risk. This is despite testing mandated and temperature screening precautions in these professional leagues. It is not a matter of if a positive COVID case will happen, but what would the plan be when it does? How does the 5 to 7 day lag time and test turnaround we currently have in Pennsylvania then expose more teams and players if teams keep playing when there is suspicion and a test pending? However, even more pressing than the athletic and extracurricular plan is readdressing the masking policy inside our schools. As a physician who has worked throughout this pandemic and not contracted COVID due to a universal mask policy inside my building, I was very surprised to learn that students will be allowed to remove a fabric face covering nose and mouth once seated inside their classrooms. There's absolutely no evidence that face shields, which you are providing to use at desks, prevent respiratory transmission. The CDC even states this. This is a direct quote from the CDC. It is not known if face shields provide any benefit as source control to protect others from the spray of respiratory particles. CDC does not recommend use of face shields for normal everyday activities or as a substitute for cloth face coverings, unquote. The fact that it is not known if shields work in this regard, and the CDC specifically states that, makes me wonder why it will be used at all in an experimental way with our children and staff. They say it may be allowed if cloth coverings are not available as an alternative to nothing. It is not meant for the purpose of reducing respiratory transmission, but rather for splash and droplet deflection, instead of goggles or over a mask to prevent it from becoming soiled. I think Radnor would want to have the safest plan we know works, and that is temperature screening and universal masking indoors. Allison Rubin, 108 Locust Grove Road, Bryn Mawr. Thank you very much for all your hard work and late nights. I'm writing because I am a pediatrician, as well as a member of the task force for Radnor reopening, and have been following all of this closely. I have a serious concern about the health and safety plan as it is written. In the health and safety plan, it states that masks can be removed and replaced with face shields for certain activities, including while children are seated at their desks. I understand this is coming from the masking order put out by the Secretary of Health, Dr. Levine, which only specifies a need for face coverings. But as I stated on more than one occasion during the task force meetings, masks and face shields are not equivalent. Face shields are intended to be worn over masks to provide eye protection. They are not known to be an effective alternative to masks. I know that some parents caught this nuance and are distressed by it. They're considering the online option as a result of this. In fact, I am now also reevaluating my decision to send my own children back to rest with this guideline in place. Even if my children wear their masks all day, they will be sitting in the same room for extended periods of time with children, and even worse, given that what we know about transmissibility, a teacher who may only be wearing a face shield. I posted about this in my physician groups and asked the question, would you send your child back to school under these circumstances? I got back a resounding no from the other physicians. Additionally, I'm concerned because I am hearing from many families, including other physician parents at rest, that they were not aware of this nuance and were simply under the impression that there is a mask mandate and thus all children and teachers will be masked at all times. If one was not watching closely at the time this was reviewed in the presentation, it could be easily missed. This should be stated clearly to parents when they are asked to choose between the in-person and online programs. I will end with a quote from the CDC. Quote, it is not known if face shields provide any benefit as source control to protect others from the spray of respiratory particles. CDC does not recommend use of face shields for normal everyday activities or as a substitute for cloth face coverings. Some people may choose to use a face shield when sustained close contact with other people is expected. If face shields are used without a mask, they should wrap around the size of the wearer's face and extend to below the chin, unquote. From Carrie and Matt Sarouche, 382 Strathmore Drive, Bryn Mawr. My name is Carrie Sarouche and my husband's name is Matt. We have twin sons in the 5th grade at Radnor Elementary. First, we want to sincerely thank you from the bottom of our hearts for your leadership and guidance these past few months. Who am I kidding? Years. Local leaders have been the one true hope this country has, and we feel fortunate that you and your team are at the heart of our district. Matt is a surgeon at Bryn Mawr Hospital, and although we are on board with our son's returning to the classroom and the methods that the district is employing for safety and learning, we have some concerns about the face shield / mask policy. We received some communication this evening that there seems to be some confusion around the face covering policy for our students. We're concerned that the face shields that the district is proposing as its standard of protection while students are at their desks is less than adequate to prevent respiratory pathogen transmission as well as aerosol transmission. The face shield seems to be more of an adjunct to the mask rather than a replacement. There's little to no evidence that a face shield provides the same protection as a mask for everyone. We're asking that you reconsider this decision and request that the board make a motion to reconsider this decision. We'd also like to weigh in on the district's policy on the flu vaccine this year. We believe it should be both offered by the school in past years and, in addition, mandated for any student returning to the classroom. The flu virus adds to the concern of exposure and is one more thing to compromise the students' immune systems. Plus, although it is not 100% effective for each individual person, it is more effective than the more people who are vaccinated. My son Cole was infected with flu A in January in spite of being vaccinated. I cannot imagine him having to fight the flu on top of the coronavirus. I wouldn't wish that on any child. Yet another piece of the puzzle to consider. We wish you the best and are hoping for every success for you and the district in 2021. Thank you for your leadership. Megan Sandor, 219 Spruce Tree Road. Good afternoon, members of the Radnor Township School Board. As a parent of 4 children in the district in elementary school and middle school, I urge the school board administration to reconsider the RTSD reopening proposal regarding use of masks for students during the school day. PA has a mask mandate in place, and the CDC, medical, and scientific community agree that face masks specifically limit the transmission of the virus. This is even more important when children being indoors together for extended periods of time. I ask that the board make a motion to revisit the masking policy and change the reopening policy to include that face masks be mandatory for students and staff for the entire school day. Beth Valen, 204 Garden Place. I'm writing as a concerned parent of 2 children at rest. My current understanding is that mask wearing is not mandated when children are at their desks, and that face shields will be encouraged and or permitted as an alternative. At present, face shields are seen as a way to protect oneself. It is not known if protection for others from the spray of respiratory particles is conferred. The CDC does not recommend use of face shields as a substitute for cloth face coverings. I'm a professor at Villanova, and our return to schoolwork plan is contingent upon all community members wearing masks at all times. Face masks might be worn in addition to cloth facial coverings, but are not permitted as a substitute. I suggest that the district follow similar guidelines. As an educator myself, I recognize that the current school year will be different, and that in some ways we are striving for a sense of normalcy. I too will miss seeing the faces of my students and benefiting from their expressions to gauge understanding and interest. That said, in these unprecedented times, we need to adhere to the strictest protection possible to ensure that the students, teachers, and staff of our district are safe. In turn, we increase the chances of a continued in-person educational experience. If we are doing this, let's do it right. Please make a motion to review the mask policy at the next school board meeting and require the face masks / coverings be worn at all times during the school day, except when entirely impossible, e.g. meals. I look forward to your public response to this issue. It is a great concern to many parents, particularly with our Friday choice of school modality looming. From Marisa Glantz Dankworth, 145 Adolph Road. I'm contacting you tonight to express a serious concern that I have regarding the safety of the school reopening plan. According to the proposal that the board passed last week, students and teachers will be permitted to remove their masks and just wear face shields while seated at their desks. That means that for most of the school day, they will just be in face shields. Masks will be required on the bus and in hallway and the bus. While I am aware that the mask order from the state just requires, quote, face coverings, which could include cloth masks and or face shields, many other school districts and private schools in PA are going above and beyond this order to require masks while students are seated too. As a case manager, I've worked in hospitals for many years, and it is well known that face shields are meant to be an adjunct to masks to provide eye protection, not a replacement for masks. To quote the CDC, it is not known if face shields provide any benefit as source control to protect others from the spray of respiratory particles. CDC does not recommend use of face shields for normal everyday activities or as a substitute for cloth face coverings. unquote. I believe that the reopening plan in its current incarnation has the potential to needlessly subject students and staff to increased risk of exposure, as well as to increase the district's liability secondary to failing to address previously stated CDC guidelines. I respectfully request that a motion be made to revisit the masking policy at the next board meeting, allowing this issue to be rectified. All the hard work by the board is appreciated. I look forward to the opportunity for the board to correct this issue. Susan Barber, 1114 County Line Road. I'm running to ask that you make a motion to revisit two policies of a health and safety plan that were approved 7-2 at the board meeting earlier this month. First, I implore you to move away from a phase 2 start in favor of starting in phase 3 with an all virtual start. As an educator in a neighboring district who had to attend a Zoom memorial service for a colleague who died of COVID-19 this past spring, I know all too well the real life implications of opening schools when it's not safe to do so. The decisions you are making this month could lead to actual loss of life or lifelong health challenges for a lot of people. Dr. Rubin and Dr. Brennan met with the Delaware County superintendents last week and recommended all schools in the county shift to a virtual start. I've listened to countless hours of school board meetings both in and out of Radnor over the past month where various members of the boards and administration claim they aren't doctors or experts. Here we have leading experts in their field recommending all Delco schools to start virtual. I feel strongly we should follow the recommendation. Although Radnor is unique in that it is smaller than neighboring districts, we don't live in a bubble. We have kids who are currently playing unmasked sports on Delco travel teams with kids from surrounding districts. We have families vacationing in the same areas as people from other districts and states. The choices we make will affect everyone in our community and surrounding communities. While I was lucky to have the choice to start my kids in the all virtual platform, their teachers weren't all given that choice. What about the health and safety of them and their families? What happens if you stick to a hybrid start and teacher after teacher choose to take 12 weeks at 2/3 pay under the COVID CARES Act? And kids whose parents selected the hybrid option will now have teachers who were quick hires and brand new to the district. Research shows virtual education can support growth while mitigating risk. By acting now to move to a phase 3 start, you take away the trauma for teachers as they worry about their safety, their kids' safety, and their students' safety. Next, I'm asking that you adjust the
Michael?
Well, we might have to continue our public comment.
respiratory particles. CDC does not recommend use of face shields for normal everyday activities or as a substitute for masks. Police require masks at all times, regardless of distance from others. 6 feet is the minimum for when someone is talking. I don't know about all of you, but kids I know are loud talkers, and I have no doubt their droplets are going much further than 6 feet, especially when you factor in that they will all have to talk louder to be heard since everyone will be spaced out. So even if you got rid of the shield allowance and require masks at all times if kids aren't 6 feet apart, permitting them to unmask at 6 feet still has the potential of transmission and is therefore unsafe. I empathize with your situation, the logistics, the hurdles, the constantly shifting landscape. Every administrator, teacher, and staff can attest to this being the most challenging time in their career. Similarly, I imagine this is the hardest decision you've had to make as an elected official. I also imagine many of you wish our governor would step in and take this direct decision from you. But you shouldn't wait around to see if that happens. You are the leaders in charge of Radnor at the moment. This decision is yours alone, and I hope you choose to best protect our children and all of your staff. I look forward to tonight's discussions and decisions. Thank you all. Thank you for all that you do in the name of our community. From Nicole Stevenson, 219 Sugartown Road. Hello, I am hopeful the schools will reopen. I am just suggesting that the younger students attend school in the morning rather than afternoon, K-3, at least. Normally, their ability to learn and energy levels are most conducive to learning in the morning rather than the afternoon. Being home from the time they get up to school at about 1 p.m. will not help the younger students academically. I feel they should come to school in the morning and for longer hours. When the crisis is over, it will be hard to get the younger students to adjust to so many changes. Thanks for listening. Paula and Franklin Strackoff, 3 Harford Lane. Good afternoon, everyone. As parents of a rising first grader, we want to thank you all for your hard work and dedication in creating back to school /cyber options for the Radnor community. We have watched the most recent board meetings and are extremely impressed with the thoughtfulness of the board/administration in the creation of the reopening/cyber plans. It is clear that everyone involved was thoroughly prepared and considered all options. There is one issue regarding the back to school plan that we would like to address. Based upon CDC, American Academy of Pediatrics, and the Chester County Health Department guidelines and numerous communications with medical professionals, masks are the most effective way to prevent the transmission of COVID-19. In addition, there is a growing consensus in the medical community that face shields without the use of masks are insufficient in preventing the spread of COVID-19. Therefore, it is of great concern that the current plan for reopening allows face shields while students are seated at their desks. Based on this foregoing, it is respectfully requested that the board administration revisit this single yet important detail of the approved plan. Again, thank you so much for everything that the board administration has done and continues to do to keep Radnor students and citizens safe. Mark McKeon, student at Radnor High School. I'm a junior at Radnor High School, a member of the varsity football team and lacrosse team, and I figured it was about time actual student athletes can weigh in on this topic. We might not have a season, let's make this clear. For some of us, we will not play a certain sport following high school, so for any of you to question why we will want to play these next 4 weeks is preposterous. No sports have had a COVID positive case directly on that team, so why have we given you any reason to shut us down? Give us this opportunity to play our last moments of these sports together. From Allison Sabar, 205 Cornell Drive. Regarding the voluntary sports practices continuing until 8:25 and then taking a 2-week mandatory pause on sports practice before school starts to help the community be ready for school. So now, instead of families being forced to stay in the community due to mandatory sports workouts, families will have 2 free weeks to travel and expose themselves to more out-of-area COVID risks. I understand the intention, but it will totally backfire when everyone takes 2 weeks of end of summer vacations and they bring back COVID as their vacation souvenir. From Karen Trossett, 501 Atterbury Road. I watched the school board meeting last night and the athletic safety plan. I too am hoping that members of the community take this pandemic seriously. My daughter is a rising freshman and is interested in color guard. I've heard great things about the band community, so I've encouraged her to get involved. But I'm very concerned about where this activity, as I understand it's not a sport, fits into the health plan of RTSD. She has been informed that they will have practices 2 nights next week, and were it not for the rain, there were practices planned for this week as well. I'll be watching for clarification. Thanks for your service. From Sobanan Sood, 113 Brook Farm Road. Hello, and I thank you to the board for your service to our school. Our daughter is a rising senior and in an ideal world, we would like her to physically return to school in September. However, as a physician, I am very concerned about the policy of voluntary masking in class. Studies around the world show that a mask worn correctly is the single most important barrier to COVID-19 transmission. Indoor transmission is extremely likely, and that is why at the hospital of the University of Pennsylvania, we are required to wear masks at all times while indoors, whether you are 6 feet apart or not. Face shields are a secondary measure but cannot be used as a primary measure. If students cannot wear a mask at all times, they should be doing remote learning. At lunchtime, students should eat outdoors or facing away from each other and be socially distanced. This is, of course, not a natural way for kids that have to behave at school, but these are crazy times. I believe that if we do not have universal masking at school at all times, we are setting ourselves up for failure and we will shortly all have to go online. Please reconsider this policy so that our children may return to and remain in school. Lisa Green, 507 Ramblewood Drive. Hi, I'm not sure you were still taking comments from Radnor residents on the fall opening plan, but I just wanted to share one more thought. I have and continue to be in support of reopening for the benefit of our students and families this fall. Having said that, I do think it will be prudent consideration for the first 14 days of school to be online. Ken Batchelor's email today made me think that it would just seem sensible to give students a 2-week time period as they all come back from various short points or summer vacations in other states to make sure they are all feeling well before coming together at school for the first time. My goal is to do all that we can to ensure a successful reopening. I just saw that you are doing a 2-week break of sports before the first day of school in Ken's letter, and it just made so much sense that I felt like it was important to voice this idea for the benefit of all students. I know you are all considering many ideas and different points of view. Thank you for your time and consideration. Becky Winter, 836 Paddock Drive. My husband and I, both physicians, again wish to express our strong concern about proceeding with a plan that allows students to substitute face shields for masks when seated at their desks 6 or more feet apart. Although a face shield helps to decrease droplet transmission and close face-to-face contact and is helpful in conjunction with a mask, the large spaces under and on either side of the face shield will allow smaller aerosolized viral particles from an infected individual to escape more easily, resulting in the particles becoming suspended in the air and circulating around the classroom. In addition, these large spaces around the face shield will make it easier for circulating aerosolized virus particles to reach another child's nose or mouth and potentially infect him or her. This diffusing cloud of aerosolized particles can be generated not only from coughing and sneezing, but also from speaking loudly and singing. In a prior email, we referenced a case of a COVID-19 outbreak at a Swiss hotel in which all those who became infected wore face shields without masks. In contrast, not a single individual wearing a mask was infected. This has resulted in the Swiss government warning against using a face shield without a mask. There have been a number of well-studied examples showing how effectively aerosolized viral particles can affect a large number of individuals in an enclosed indoor space, including at a choir practice in Washington, at a call center in South Korea, and at a restaurant in China, and on a bus in China. These examples also underscore the critical need for adequate ventilation, including avoidance of air recirculation. A rising first grader can wear a mask without difficulty for many hours at a time. I am confident that given the appropriate guidance, the vast majority of children will be able to do the same, especially since at the elementary level, in-person instruction will initially be limited to 2.5 hours. We need to normalize wearing masks in the same way that, for example, we wear other articles of clothing. At this time, it's just something that everyone has to do. That being said, we think it is acceptable to substitute face shields for masks when students are outdoors, including during recess and gym, as the diffusion of viral particles in the outdoor environment is much greater than in an enclosed classroom. Thank you again for all your hard work in planning to reopen Radnor schools safely. Subaya Kidwai, 673 Mill Road. My daughters will be going into grades 2, 5, and 7 at Radnor Elementary and middle, respectively. I have reluctantly opted for the hybrid option in order to give them some level of normalcy. However, my most recent concern is seeing all the other schools going only virtual. This leaves me wondering why Radnor has given parents a choice which seems to be leaving RTSD in the minority. Should I assume that Radnor feels much more prepared to handle the crisis? Or is this in fact a false level of comfort and they feel pressure by what parents are asking for based on the survey results taken in June? Patricia Holtz, 724 Governor Circle. Hello, I'm writing to express my opinion that all high school students must be masked at all times while indoors, even if they are 6 feet apart. I can understand the challenges of elementary students wearing masks and seeing facial expressions, but for middle and high school students, I think they can and should comply with face masks for their own safety and for teacher staff safety. I worry about teens getting severe COVID or MIS-C, and I worry about teachers and staff getting severely ill. There's a great deal of evidence about the effectiveness of masks. My daughter is eager to return to school, so I hope we can find a safe way. Thank you. Wally Zimalong, 673 Jefferson Road. I urge the board to vote no to requiring face masks and shields to be worn in school all day. As the school board admits its current requirements exceed CDC in common with guidelines, there is no scientific or medical basis for this additional measure. To the contrary, it could harm students by preventing oxygen flow to their brains. Unlike the board's mask guidelines, scientific and medical studies universally acknowledge the lack of oxygen flow to the brain is harmful. From Paul Passless, 129 Gallagher Road. Neighboring districts Lower Marion and Triffin Easttown are both starting out fully virtually. LM starts virtually on September 8th and won't open up further until at least October 5th. TE starts virtually on August 31st and won't open up till at least September 21st. Since Delaware County leads the state in COVID cases right now, we believe that it would be safest if Radnor would also start out with fully virtual instruction. Leanne Gassick, 7 Cornwall Circle. Dear board members, I'm an infectious disease physician and parent of rising 7th and 9th graders. Prior to leaving academia to pursue a career in drug development, I was a physician, researcher, and epidemiologist at the University of Pennsylvania, where I worked on pandemic preparedness plans for situations such as we now face with the novel coronavirus. From these perspectives, I'm writing to provide my support for the plan to start school under the modified in-person hybrid model, which was discussed and approved by the board on July 28th. It is critical to look at mitigations put in place to reduce risk at school, the infection rate in the community, and the overall risk/benefit to each child. First, it is clear that the board and the administration have extensively researched and considered best practices and have subsequently taken all precautions necessary to mitigate risk at school. The planned hybrid model meets or exceeds available guidelines, thereby minimizing risk to both students and teachers. Reports from other countries such as Norway and Denmark show that schools were able to reopen successfully using risk mitigation practices. Other countries such as Israel, where school reopened without masking or social distancing rules, did not have the success and subsequently needed to close again. Unfortunately, COVID-19 persists in our community. Based on data from August 10th, Pennsylvania cases decreased by 11% over the previous week, and our rate per capita was among the lowest in the country. Only 8 states were lower. Cases in Delaware County have risen recently, though, and our case rate is among the highest in the state. However, the PA Department of Education has indicated that a rate of 10 to 100 cases per 100,000 population in the most recent 7 days will be acceptable for either hybrid or fully remote learning models. As of last evening, the cases in Delaware County over the last 7 days were 74 per 100,000 and well within the range outlined by the DOE. Furthermore, county lines are arbitrary. According to an article in yesterday's Philadelphia Inquirer, Delaware County has seen concentrations of COVID-19 cases in towns with nursing homes, where older adults with fragile immune systems and multiple chronic conditions have been particularly vulnerable to the virus. In addition, large clusters have been seen in specific towns such as Yadin. Radnor is not a hotspot within Delaware County, and our population-adjusted rate is much lower than the overall Delaware County rate. Finally, tracing has shown in Philadelphia that many cases are coming from people returning from vacations in other states, including the Jersey Shore. Returning to school, especially if school is in person, will decrease the number of cases brought back locally from travelers. Regarding overall risk/benefit, each family needs to weigh the risks and benefits of a hybrid versus fully virtual educational model for their own children. The current plan allows this, but a fully virtual model will not. Each family has different concerns regarding the virus, which may be based on vulnerable family members or other factors. For some children, the mental health implications of isolation are substantial. Notably, data from Safe to Say Something, PA's harm reporting system, show that tips related to self-harm and suicidal ideation among students increased from 17% to 37% of reported tips from March 13th to July of this year. In addition, some students will struggle academically in a completely virtual setting, while others will excel. For these reasons, providing both options, part-time/hybrid in-person learning and fully online learning, is ideal. Finally, I strongly believe that should we need to change to a fully virtual model in the future, an in-person introduction to new teachers, a new year, and in some cases a new school is invaluable to students, even if only for a short period of time. This opportunity will produce a strong foundation for learning and interacting with teachers while at home. The well-thought-out hybrid plan proposed by the administration will ensure smooth transitions to fully virtual learning in the event that the switch needs to occur. Finally, I've spent a large part of my summer practicing social distancing at the Jersey Shore, where I have witnessed scores of tweens and teens traveling in large groups without masks and without regard to any sort of social distancing. A classroom where appropriate social distancing measures are enforced is certainly preferred to how many of our youth have spent their time this summer. There are no clear-cut answers, but everyone wants to do what is right for our children. For this reason, I hope that you will not reverse your decision to begin school with a hybrid model of learning, with an option for fully remote school for families who prefer this option. Number 26 from Allie King, Radnor Elementary School PTO President. First, thank you to Radnor Township School District and our school board for your hard work. As a parent and a former teacher, I feel it is imperative for schools to at least afford taxpayers the option to open in person this year, especially at the elementary school level. Given that the original plan was discussed and approved, this seems to be the most logical and fair decision. I'm frankly concerned that this decision is being reevaluated when restaurants, malls, sports training, and more remain open to the public at this time. I'm concerned for the education and social and emotional well-being of our children. Although numbers may be increasing in Delaware County, to which Radnor is the northernmost tip, We should be evaluating numbers in our community, Radnor Township specifically, for data best representing our individual needs as a community. We are all affected by this pandemic. Many community members and parents are essential workers who have had to piece together childcare without additional funds and resources. Schools should be viewed as essential businesses, which our taxpayers fund. Schools should be a main source of support for our children at this time. Our community needs to come together now more than ever. I implore our school board and RTA to proceed with the original reopening plan. Whatever the outcome may be, I will continue to remain a proud and supportive parent in RTSD. Thank you for your time and consideration. Melissa Skies, 720 Mainland Road. Hello, thank you for all your hard work during this difficult time. I'm the mother of rising first grade twins at Eichen Elementary. My husband and I signed them up for the cyber option. Can you please address how IEPs and 504 plans will be managed with the cyber option? When will this information be available? Thank you. Hillary Lehman, 19 Haymarket Lane. My name is Hillary Lehman, and my oldest son is registered to start kindergarten in the fall at Eichen Elementary. I've been following the situation closely. I thank the school board members and the administrators who are working so hard to sort through this complicated situation. I've been impressed with the diligence and thoughtfulness with which it seems as though you have approached these current challenges. My son is currently registered for the in-person option, which I understand is currently planned to be half days in school and half days remote. My comments here relate to any remote instruction situation, whether it's the half day we are currently planning on or a full day of remote learning per phase 3. If I understand the plan correctly, the phase 2 remote program would have my child follow a 2.5-hour program from home during a specified time frame, and a phase 3 remote program would have my child follow a 6-hour and 33-minute program from home during a specified time frame. My impression is that while breaks will be worked out into the schedule, the time frames will be set with no flexibility for the child or parents. I don't envision that this will be a successful approach for a kindergartner. I think it might even be a net negative. He will hate having to sit in front of an iPad all day. My husband and I will hate having to supervise him. And let's all be honest, he and just about every other kindergartner is going to need a lot of supervision. I'm not sure how my household, which consists of 2 parents who work full-time, a kindergartner and a 4-year-old, will be able to adjust our schedule so that my son can be available during set times each day. I'm not convinced he will learn anything meaningful such that this will be all worth it. My request is to the administration and the board is to offer a flexible option for parents to teach their kids from home without being tied to the schedule of the iPad, yet still remain part of the district. Maybe this is providing written materials to work from and having check-ins with the teacher. Maybe this is providing parents with objectives that need to be achieved and having some way to measure progress. I'm no expert in what will be best here, but I do know that the rigid schedule that is part of the current remote plan will be a tremendous burden. And I truly question how much the students will really learn and whether that learning will be worth the frustration that will come with it. I want to acknowledge that I know some, perhaps a lot of families, want just the opposite and want exactly what the plan offers. We do not, and I want you to hear my voice on this issue. I realize that we do have the option to homeschool, not cyber school through the district, but old-fashioned homeschool according to the pre-COVID definition. We are seriously considering this option. It is not our preference to withdraw our child from the school district. It would be great to have similar flexibility within the district during this time. Another option to consider, at least in phase 2, would just be half-day in-person programs for younger kids, with remote log-on purely optional. As a parent, I want you to know that I am 100% comfortable if my son doesn't get science and social studies this year. I've come to realize that this year will be different, and he will be fine. The framework of the remote program, whether the all remote option or the program in phases 2 and 3, seems to be centered around the goal of being as much like regular school as possible. Same timing, same subjects, as little trimming of optional subjects as possible. As much as I appreciate the good intentions here, I think we are aiming for the wrong goal entirely. I wish the goal weren't as much like regular school as possible. I wish we could collectively, in Radnor and beyond, lower our expectations regarding content covered in school this year. It's hopefully only one school year. In elementary school, it is not going to make or break any child's future if the class only covers half of the material. It will all be fine. Focus on the important stuff: reading, math, good communication, character. Let go a bit of the other subjects. Maybe allow teachers and families to find time and energy to spend with children in other ways. allowing for more organic educational opportunities. Let's find ways to make the best of this situation instead of exhausting ourselves while we stumble through trying to make things as normal as possible when we all know things are not normal. Thank you for your consideration. Andrew Foreman, 805 Mainland Road. Good evening and thank you for your diligent work in planning a safe opening for our Radnor students. My name is Dr. Andrew Foreman. I have an incoming 10th grader at the high school, but I'm writing to you with my perspective as a board certified pediatrician. I've been in practice for 18 years and spent several years recently on the Radnor Township Board of Health, both as a member and as the chairman. I've also served as a vaccine educator for outpatient medical practices for the American Academy of Pediatrics Pennsylvania chapter. My major concern tonight is focused on our high school students removing their masks and eating lunch indoors, even with social distancing being observed. Current evidence indicates that prolonged indoor exposure without masks and good air circulation may aerosolize viral particles and lead to spread. This knowledge comes from contact tracing from restaurant spread. I'd ask the board and administration to consider how students who choose to attend high school in the building can eat their lunch safely. Removing masks indoors with people outside of their immediate family is contrary to current safety practices. My practice is located in Chester County, and I'm in contact with their Board of Health. I inquired about the data they use to support their recommendations on shield use and on indoor lunch being allowed. They report they are using the state guidelines. The county could offer me no other data to support the safety of shields or an indoor lunch. After carefully reviewing the state and CDC websites, combined with my professional knowledge and experience, I cannot agree with the guidelines you have used to allow groups of high school students to remove their masks and eat in the same room. The guidelines do mention offering outdoor lunch when possible. Has a policy been made for outdoor options? Will Radnor consider allowing individual students the choice to eat indoors 6 feet apart? Have you considered bringing in tents for inclement weather? I advise my patients and my family not to remove their masks indoors whenever possible. The RTSD plan for indoor lunch is, in my professional opinion, a serious risk for transmission. Thank you for your time. From Rob King, President, RTEA. Good evening, Radnor Township School Board members, school district administration, Radnor community members, and Radnor teachers and staff. My name is Rob King, President of the Radnor Township Education Association, and I am addressing you this evening on behalf of some 310 teachers, librarians, social workers, nurses, and psychologists. In a recent letter to RTEA members, I quoted Thomas Paine, who wrote at the outset of the American Revolution, "These are times to try men's souls." I think we would all agree that the COVID-19 pandemic has and continues to try our collective souls. Furthermore, I believe that until we have an effective vaccine, the virus will continue to disrupt our daily lives, making pre-COVID life a distant memory. The members of RTEA are proud to work in one of the premier districts in the state and indeed the nation. We are grateful for the students with whom we interact on a daily basis, and we have the added advantage of adequate resources that allow us to maximize the intellectual growth and progress of our students. We recognize the recommendations of many of the organizations that have come out in favor of in-person learning after the unexpected school closures of last spring. We do not dispute the fact that in-person interaction is the best mode of teaching and learning, and members of RTEA are eager, as many parents and community members are too, to see schools reopen. We also recognize the tremendous time and tireless efforts that the school district administrative team has dedicated to studying and implementing safety measures to make the reopening of schools as safe as possible. RTEA has also been hard at work striving to gather data and research in order to be informed of the most current information surrounding the virus, the case numbers in our area, and how to best proceed with the decision to reopen schools in September. Therefore, in a spirit of collaboration that we feel is so important to the success of our schools, RTEA respectfully asks the school board and community to hear our members' concerns with regards to the current plan to reopen schools for in-person learning this September. In an August 7th to 8th survey of RTEA membership, in which 90% of our members participated, 75% of our members expressed that they were either uncomfortable or very uncomfortable returning to schools. Most of our neighboring school districts have announced within the last week or so a similar course of action. Our request is to ask the school board to change course is based on the evidence regarding the transmission of the virus in Delaware County, coupled with the fact that many families, students, and community members will be returning from their end of summer sojourns at the shore or other holiday locations, increasing the risk of new infections in the first weeks of September that could pose a problem for our schools. The Pennsylvania Department of Education's August 10th publication of new metrics to help guide school districts in their planning suggests that Radnor falls in the moderate zone of the three-part scale. In this moderate zone, school districts have an either-or choice: reopen schools using a hybrid model or adopt remote learning. While the most recent data regarding the virus in the state of Pennsylvania and in Delaware County show a decline in cases, that is based on a 7-day average, and we believe any decision should be based on a 30-day average in order to have a clearer picture of case trends to guide all decisions about in-person versus remote learning. RTEA understands the challenges of starting the year virtually. They are not insignificant, and many of our members are dealing with the same challenges as our parent community, as their home school districts have pivoted to a virtual start. RTEA remains committed to providing our students with the high quality and engaging education the Radnor community expects, and our members have been hard at work this summer completing professional development programs aimed at enhancing the effectiveness of blended, flexible, and virtual learning. Therefore, RTEA and its 310 members urge the school board to opt for virtual learning for the beginning of the school year. We believe that this would solve many of the challenges associated with the opening of schools during a pandemic. Thank you to the board, the administration, and the community for listening to us and for your ongoing support and commitment to education in Radnor. We, the teachers of RTEA, are and remain Radnor proud. From Sarah Bradley, 404 Conestoga Road. I urge you to require face masks of students even when at desks 6 feet apart. I commend you for already making recommendations that are safer than the minimum requirements. But as our district does in other areas, we should strive for excellence by setting the bar higher and making the in-school environment as safe as possible, not only for our students, but for the health of our wider community. Perhaps it will be also possible to make some changes to the daily schedule to allow classes an opportunity to be outside and socially distanced for mask breaks, for walking breaks, or even instruction, where it has been scientifically shown that the risk of transmission is lower. Perhaps middle and high school lunches could be under tents outside if it's impossible to have lunch with the same individual class each lunch. Thank you for requiring masks in music class, as singing has been scientifically shown to increase the risk of transmission. Perhaps accommodations can be made to allow for outside band practice, and for orchestra, there could be no sharing of stands to spread out and maintain social distancing while wearing masks. Please continue to keep Radnor held to the highest standards and keep safety the utmost priority so we can keep our children in school as much as possible and protect our community. A mask requirement will help. Another follow-up from Sarah Bradley, 404 Conestoga Road. I urge you to follow the state's recommendation of suspending competition in intramural sports until at least January 1st. The compromise could be allowing for practice to continue, taking the necessary precautions, social distancing, masking as much as feasible, especially when indoors, and playing outdoors as much as possible. This will limit the risk of spreading the virus that is inherent to interactions outside of our district community, while allowing the children to still get the benefits of exercise in a structured social environment, whose importance for the children's physical and mental well-being and development should not be discounted. Mary Beth Doyle, 507 Meadowbrook Circle. First of all, thank you for your continued efforts to create a safe reopening of all our schools, as well as for the opportunity for our community to share information and perspectives. To that end, I would like to offer information on the dangers of face coverings, particularly for children. Medical, scientific, and occupational health experts have presented information on the negative impacts of face coverings, including lower oxygen levels, higher heart rates, headache, nausea, fatigue, and these are all in healthy children. Risks are even greater in people with health conditions such as asthma, COPD, allergies, and other respiratory conditions. Indeed, even Dr. Fauci initially stated that people should not wear face coverings because of the risk of infection caused by people fiddling with their face more due to face coverings. In a recent interview, a 20-year OSHA certified PPE expert addressed the fact that medical professionals are able to tolerate face coverings all day because the environments in which they work have been adequately controlled to assist them in working with masks by increasing oxygen levels, improving airflow, and adjusting humidity and temperature levels. I assume that these activities will not be done within the school buildings, and so the environment will not be appropriate for children to be in face coverings all day long, certainly not without breaks. Given Governor Wolf's current executive order, I understand that face coverings are required for students in schools. However, even the order states that face coverings are not required when students are, quote, seated at desks or assigned workspaces at least 6 feet apart, eating or drinking with space at least 6 feet apart, and engage in any activities at least 6 feet apart. So I have the following questions. 1, if Radnor is able to maintain 6 feet distance between students in the classroom, why would we put our children at risk of any of the health hazards associated with face coverings while they are in class? Can you share the data that led you to the decision regarding a face covering policy that exceeds the governor's order? 2, will students with medical conditions be exempt from face coverings? 3, most importantly, if the school board adopts a face covering requirement, what is the criteria the school board will use to terminate that requirement? Will it be when Governor Wolf announces that masks are no longer needed? When Delaware County reaches a certain COVID infection rate? When a COVID vaccine is available? Or does the board believe that masking should be used indefinitely? I've heard some people say that they support face coverings simply because they are required by the governor, while others support them because face coverings represent an effective supplement to social distancing. I think it is important for our community to know why, specifically, the board is enacting its face covering requirement. If the board is doing it simply because the governor ordered it, then the board should include in its policy an explicit statement that when the governor ceases the face covering mandate, Radnor ends its requirement automatically. If the board is doing it for any other reason, it should communicate that now, before it votes on implementing this policy, the specific criteria for ending it. That way, we can better understand the likelihood that our children will remain in face coverings through their high school graduation. I'm happy to share the data I have compiled on the dangers of masks, so please do not hesitate to reach out to me. Thank you again for all your efforts. Joshua Barber, 1114 County Line Road. I've worked in the U.S. Environmental Protection Agency for over 18 years. Based upon my review of the RTSD Health and Safety Plan, and after consultation with my EPA colleagues and the recent information that EPA researchers have released regarding COVID-19 and indoor air quality, I wanted to offer the following comments. The Health and Safety Plan appears to reference practices regarding the HVAC system on page 11. While the document states that ASHRAE recommendations for additional outside air will be implemented as feasible, and that various other steps will be other options and experts will be consulted regarding HVAC. No details regarding filtration, room occupancy, etc. are available. A growing body of research and evidence is being produced regarding the best practices and minimum standards that should be followed. Prior to opening for the first day of school, the RTSD should share the findings of their efforts and the steps that will be implemented to ensure that the spread of COVID-19 via building ventilation systems is minimized. Not only is a greater volume of outdoor air exchange a primary recommendation of ASHRAE and EPA, but so too are several other specific guidelines. I've attached the ASHRAE Epidemic Task Force guidance for reopening schools and universities for reference. Specifically, a filter with a MERV 13 rating is required to capture airborne viruses. Protocols to handle air cleaning for quarantine areas prior to reoccupation should be established, and specific standards for nurses' offices are recommended throughout the guidance, plus much more information. I've also included a link to a recent EPA webinar presented by indoor air quality researchers regarding COVID-19 and indoor air, as well as the main EPA resource page for this topic. Among other items, researchers raised the density of students allowed in a room and the potential for carpeting to retain and reintroduce viruses each time people enter or leave a room as just some of the additional mitigation factors to be considered. I look forward to the RTSD board continuing to research this matter amongst all the other challenges with which you are faced in these times, and hearing about the specific mitigation steps that will be taken. My coworkers and I are happy to provide support in these matters to ensure that the appropriate health and safety measures are taken before schools reopen. Claire Sari, 101 Woods Lane. The main focus seems to be on reopening school when it is inevitable that we will go all virtual at some point. Is Radnor prepared for the children that will be online from the start and for the other children in the upcoming months? It seems like it's education in person versus health and safety for children, faculty, and staff. Parents aren't the only ones that have a say. The faculty and staff that teach the children and have health concerns are so important too. From Rachel Sule, 415 Midland Avenue. We should compare our community with statistically similar communities. We are smaller than most districts in our area. Let's gather the data from our township, compare with similar communities nationwide in size, demographics, etc., and use that data to make an informed decision. How can we, as Radnor citizens, help to accelerate local testing? From Gail Morrison, 111 Poplar Ave, Wayne. As I wrote to the board on Friday, I do not believe it will be legal to take a vote tonight that changes the approved plan and endorses an all virtual start to learning. I did not receive an answer as to the proper advertising of this meeting. No vote can be taken at a meeting not properly advertised. I also must state on the record that the state data being used in this discussion is wrong. The accurate daily new cases per 100,000 people in Delaware County's population is 11 for the period 7/26 to 8/1. 78.6 is not accurate. Our test positivity rate today is 3.4%. We are at the guidelines to proceed with some in-person in-school learning. Any decision to start school wholly virtual does not comport with the data and the science and is gravely inequitable. I'm deeply disappointed we are not having a more honest discussion tonight. We have a plan that can safely open schools for everyone who wants it and needs it. From Gina Visor, 1000 Conestoga Road. According to Dr. Rubin, Delco is averaging above 10 to 12 cases per 100,000 per day. Testing positivity hovers at 5% in Delco and is not declining. He recommends less than a 3% testing positivity rate for COVID tests prior to reopening. New York will not reopen schools until its positivity rate is below 1%. Also, based on his assumptions, Labor Day could significantly increase the risk of COVID transmissions. Why are we risking students' and teachers' lives? It is obviously safer to begin the school year online and reevaluate in October. We need to heed the medical professionals' advice. My children will be returning to school online. Please, let's reevaluate the district's plan. Now, we had a couple come in while I was reading. Would they qualify, or would they have to hold until the next meeting?
No, we didn't give a cutoff tonight, so go ahead and read them. But how many more are there, Mr. Petiti? That was the 40 you received tonight?
Yeah, so those are the ones that came in kind of as I started reading. And then
Sure.
a couple came in as I was reading, and I know we don't have a second round of public comment tonight.
No, that's right. So how many more do you have?
Let me see. Another one just came in, so. Four.
Okay, continue, please.
Susan, can I make a motion that we cut off public comment after that hasn't arrived already?
I don't think we can. We didn't advertise a cutoff. And the fact is, if we were we didn't set the meeting up that way, Sarah. And the reality is that if we were sitting in a room and everybody were in the room, they could just keep coming up. So we're just going to forge ahead.
Okay.
There's a few more and then see how we do after 4 more comments. Thank you, Michael.
You got it. From Kevin Geary, 4 Blackfriar Road, Bryn Mawr. I urge the board to continue to uphold the previous vote to begin the school year with a hybrid model. Radnor has always been a leader, and I firmly believe that the administration is up to the challenge to protect our students, staff, and families. I have faith in the health and safety plan and urge the board to continue to do the same as they have previously voted. Reopening as approved allows the administration to learn and adapt their social distancing in the classroom. Kids at home do not. If the school year begins virtually, the challenge to reopen will be much harder, both logistically and politically. Please know that if we don't reopen as previously approved, it is doubtful our children will ever see the inside of a classroom for the 2021 school year. Thank you for your service. I don't see an address in here. I just see a town. So I'm going to skip that. I don't see a street name, I should say. Mark DiGiovanni, 54 Oakford Road, Wayne. I would first like to thank the board and the administration for their hard work and professionalism in dealing with this unprecedented challenge. I think it's important to note that this is not a binary decision, meaning that there is risk in going to school and zero risk in staying home. That is simply not true. There are risks in both scenarios. School attendance poses the risk of exposure and transmission. However, there are many risks in staying home as well: an impaired learning experience, lack of socialization, isolation, depression, suicide, parents unable to return to work, and domestic abuse. I feel particularly bad for this year's seniors. My daughter graduated from RHS last spring and missed out on some of the best experiences of her senior year. The challenge is in balancing these risks. At this point, one of the positives is that the fatality rate is way down. Further, the vast majority of young people afflicted recover within a few days. A concern with reopening is students and staff with pre-existing conditions and staff over the age of 60. If school reopens, those in these high-risk groups should be required to participate remotely. In addition, guidelines must be followed: social distancing, regular hand washing and sanitizing, and masks. Students who are not feeling well should be instructed to stay home until they recover. Another concern is students who participate in sports and other extracurricular activities. My sophomore daughter participates in band, crew, and basketball, and now they will all be taken away from her. Therefore, I think it's at least worth the risk to reopen and to monitor the situation closely. If there is an increased infection rate, the virtual option is available as a fallback. This is a fluid situation which will no doubt result in progress and setbacks. Nevertheless, we cannot be paralyzed by fear, but must move forward with due care and diligence. Thank you for your consideration. And that's all. Oh, nope, Kelly, this person just sent their address. Sorry. This is Kelly Martin, Edge Hill Road, Wayne. First, a huge thank you to Superintendent Ken Batchelor, our administrative team, teachers, and the school board members who have worked hard to be informed, educated, and ready for all that's needed to safely reopen Radnor schools. I know you have the impossible task of working with an unprecedented and fluid situation with so many variables, and I applaud your devotion and efforts on behalf of our community. I don't think I'm alone in wishing we were all preparing for a safe return to school in September, as that's not the case. We can only hope for the safest possible return to school and normalcy in the fall. That being said, I'd like to add my 2 cents. I like to see everyone's temperature taken as students, teachers, and administrators enter the building. I currently visit Penn Medicine weekly, and my temperature is taken every time I enter the building. I think this is our best chance of preventing the spread and should take priority over distancing and masking. Next, the mask policy should be revisited, and we should adhere to the CDC guidelines for masking when we're able to abide by the 6-foot distances. My daughters are rising 7th and 10th graders who are looking forward to being back at school part-time in the fall. I'm also excited for them to get back to their buildings, teachers, friends, and communities. However, I believe our kindergarten through 6th graders should be prioritized. I'd be willing to offer up our 2 seats in the middle and high school if it would help get those students into class and face-to-face with their teachers. If there's any way possible to spread the K-6 students throughout the buildings for the first quarter at least, I think that should be the goal. From my experience as a Radnor student for 13 years, to my experience as a Radnor parent for 10 years, our K-6 programming is crucial. The interactions our young students have with teachers, aides, and friends will shape their view of the world. This is when they learn the qualities of a learner, establish a love for reading, build a community, and learn to rely on grown-ups aside from their parents. My family's world was made better by the teachings and friendship of Mrs. Weinstein, Miss Wiley, Miss Grime, Miss Baker, Mr. Serpico, Miss von Herstenberg, Mrs. Chain, Mr. Moore, Miss Willens, and the simply incredible Dr. Stevenson. I know you're all working with an impossible situation, trying to make the best possible decisions for all. We all hope this is temporary, as we thought it was back in March. but for a kindergartner, they've now spent about 1/10 of their life isolated from school, teachers, and friends, and data shows these students don't pose a threat to our wonderful community of teachers and staff. If it's even remotely possible to put more emphasis on getting our young learners back in school full time, I truly hope that it will be explored. And if you wait to reopen in October, families will continue to travel, so please dismiss that recommendation. Dorothy Potash, 320 Julep Run. Thank you for your thoughtful consideration. I'm writing to beg you to require all students and staff to wear masks while on campus, indoor and outside. Further, I am also writing to beg you to reconsider lunch. No one should be sharing lunch with masks off. This is so dangerous and unnecessary. I further implore you to think about the day itself. Stick to what is most important. Stop trying to keep things as normal as possible. There is nothing normal about this virus, nor is it normal how we must live to combat it and keep people safe. Instead of trying to make a new norm feel as normal as possible pre-COVID, we should really be reinventing our Radnor education. It is disappointing that everyone is so focused on doing things as closely as possible to how we used to do things, instead of being creative. However, here we are, school is about to start. I suspect not much can be done to reinvent at this point, but what we can do, what we still have time to do, is to require every single individual on campus to wear masks. If the parents want students in class in person, then everyone owes it to everyone in our community to wear masks. There has never been a better time to teach our students about the important message related to thinking beyond yourself, thinking about being part of something larger, making sacrifices for the greater good. Wearing a mask is not dangerous, does not cause disease. Follow the science, not the politicians. Thank you. And lastly, as I read this, Cheryl Parente, 603 Fox Field Road. I've been listening to the many comments urging you to start the year online. Thankfully, you are offering that option. Please stay the course with your hybrid plan.
Okay,
That's
thank
all.
you. All right, public comment is closed and we are going to move into our priority action item. Mr. Batchelor, is there a presentation or discussion? How do you want to have this go? What I'd like to do, because we're going to roll into a conversation after the presentation, is after the presentation, I can entertain a motion.
Sure. So there's two pieces. So one, we have a continuation of the presentation from before that really kicked off the meeting that we wanted to finish, that is involved with the priority action item, but the priority action item is actually pretty clear. Administration is recommending adjustment of that, the masking requirement. It's interesting, the discussion we had, and we'll talk about that as we do that with Dr. Rubin and Dr. Brennan. So there is, for the discussion based on, the update, there is a larger presentation that we still wanted to finish. So I could begin that now, and then we can move into this priority item. Does that make sense? The presentation now would put some context into board discussion for the information that we received earlier in the meeting.
Yeah, I'm just a little bit concerned. So we can certainly have Mr. Dukevich is going to do the presentation, or Mr. Bechtold?
They'll be joining me. I'll be doing most of it, though. The three of us will be doing it together.
Great. All right. So why don't you do your presentation and show the things you want to show, and then, but before we really start any discussion, we should take the motion, because we need a motion to be, they're gonna roll into one another with questions and comment and discussion.
They are. So there is the presentation is a continuation from the presentation before, and there is no motion tied to the presentation.
Correct.
So the presentation is a context for discussion. There is one motion on the table for tonight, recommendation, and that's about our masking. And we don't have a presentation with that. It's really very straightforward, that recommendation for an adjustment.
I understand that. I'm just wondering if and you know better than I, if your presentation is going to lend itself to the kinds of questions that would come up around this priority action item.
No, I don't think so. I think that it'll be separate. I think it'll be separate.
All right.
The presentation is really more of a context for, we only had the two doctors available right at 7 o'clock. We had to, follow their schedule. It's really a context for a discussion that I think we as a board need to have tonight, a larger discussion just on the status of our opening. So it's really going back to the earlier part of the meeting and presentation and discussion over the status of our opening plans.
Okay. All right. We really, so let me just say, and Mr. Christofko can weigh in on this if I'm going off the rails in terms of my thought process there, but because this is a special meeting and we've already finished our public comment, and we've advertised this one particular priority action item, we should really, how would we handle it if anything significant comes up in this presentation, since we've kind of changed, we're reworking the order of this meeting a little bit tonight, just out of deference to Dr. Rubin and Dr. Brennan's schedules tonight.
I mean, procedurally, probably the best thing to do would be to have the presentation first, and then to make the motion, either the one that's on the agenda or whatever one that the board feels appropriate along the same subject matter. I presume that the meeting was advertised to address this matter as well as any other matters which may come before the board, which is the typical way that special meetings are advertised. In which case, that way, you could address the specific issue on the agenda, as well as the board could make other motions along the same lines to address.
We did advertise this meeting, Mr. Thatcher. You confirmed that this item was advertised in, was it the Delaware County Times yesterday?
I believe the Daily Times. Let me look that up and confirm, but yes, the meeting was advertised.
Okay. And for a special board meeting, Mr. Christofko, which this is advertised, we needed to provide 24 hours meeting notice, correct?
That's right.
Okay. And we do typically I believe we do typically use the Daily Times. That's not like we did a different newspaper.
So I'm just looking up for the email for the confirmation. Yes, it is. We used a similar process that we used before for special meetings.
Okay. All right. Well, why don't you start with your presentation, and then we'll go from there.
Okay, great. Thank you. So we wanted to talk about, obviously tonight, the beginning part of the meeting was very sobering. And we want to talk about what has changed since July 28th. And we want to share where we are as a district. And I want to also try for the board to frame an opportunity for a discussion tonight. We were not looking for necessarily a vote, but that is certainly something that the board can entertain tonight as well. The only thing that is actually on for an action item tonight is that adjustment to the masking protocol, which we will talk about when we get to that point on the agenda. So we have been working hard, as everybody knows, to put together to make our plan come to reality. So if we move the slide to the next page, today we had our special guests with Dr. Rubin and Dr. Brennan, and they discussed with us, and as I said, some very sobering information that they have been sharing with superintendents across Delaware County. We can't thank them enough for being available to help guide us as we've looked at this work and looked at it from so many different angles. As a district, the next slide, we had our administrative retreat today, and it was just wonderful to bring back and see our administrative team, together, following the masking guidelines, following all of our guidelines and procedures. We came together today to talk about how we actualize and how do we make our plan that we approved on the 28th work as a district. And besides just being focused on opening schools in this retreat today, and then tomorrow as well, our administrative meetings, we're also focused on some of the areas that we're looking to improve the Radnor education. So as much as the focus is on opening schools, our multiple tiered systems of support are focused on, we had a training this afternoon on equity as well, and inclusion. We are focused on our initiatives as well and trying to keep our district moving forward, even while we are dealing with the opening of schools. So I want to thank our administrative team for coming together today, their thoughtfulness, their hard work. We realized that it's been since February. We've done a lot of Zooms, but it was nice to actually all be together. And even though we were masked and even though we were following all the protocols, it was a very productive day. We created a video that I don't know if I'm going to take the time to share tonight, But just in talking about our plans of trying to reopen, I might just show a small piece of this, but every administrator is working around the clock to figure out how do we open up schools. And this video was a great example of some of the information that we're preparing to share for our families for when we open. And obviously that is a discussion that we're going to be having soon. But I just wanted to show this care and have our families see and our staff see all the work that's going into trying to plan for opening. So Dr. Hand, if you don't mind, could we just show maybe a few minutes of it, and I'll signal to you when we can stop, because I think it is about 3 or 4 minutes long, if I recall.
The following stipulations have been put in place to ensure the health and safety of all Radnor Township School District students who will ride the bus during the Phase 2 opening of our schools. Roof vents and windows will be open on buses, weather permitting, to increase air circulation. All employees operating district-owned vehicles will be required to wear face masks. Disposable face masks will be available on each bus in the event a student's face mask breaks, becomes soiled, or is lost. Students will be required to wear face coverings at the bus stop and on the bus ride. Social distance of 6 feet should be adhered to at all bus stops. Buses will load back to front with assigned seating. A maximum of 2 students per seat will be permitted. No students will be permitted to sit in the front row of the bus directly behind the bus driver, and members of the same household will be seated together whenever possible. Students exhibiting COVID-19 symptoms will not be permitted to board the bus if their parent or guardian is present. Should parents not be present, bus drivers will contact the transportation department to have an administrator and nurse meet the bus at drop-off to take the student to the isolation room. Parents and guardians are encouraged to drive their child to school whenever possible to reduce passenger volume on buses. Bus drop-offs and pickups will be staggered to minimize person-to-person interactions at the start and end of each school day. Upon exiting, buses will unload from front to back. Students will be greeted at the drop-off and guided to their classrooms. Buses will be cleaned and disinfected after each AM and PM run. Please visit the Reopening Radnor webpage found at www.rtsd.org for more detailed information. Reopening Radnor. Be safe, be healthy, be proud.
So as I mentioned, there's a great deal of work that is going into and being prepared for all 3 of our phases and figuring out how do we safely open up Radnor. We want to make sure that our staff, our community feel safe. I feel confident based on the guidelines, based on what we are looking at, that we as a district can meet those guidelines. But as we heard tonight from Dr. Rubin and Dr. Brennan as well, it's not just about meeting the guidelines, it's also what's happening in our community we have to take into account. We have discussed at other meetings the idea that we need to look at metrics and be prepared to talk about those metrics, and we've been frustrated the last few weeks that the metrics didn't exist. We now have the metrics, so I want to give some context for that discussion as well. So this meeting tonight, this presentation is an update to the board. It's also to share that new guidance that everybody's talking about that came out yesterday. I'm losing track of days, but it was literally yesterday. That is, again, the nature of what we're dealing with. And then also some administrative considerations and some questions and answers, both tied to the presentation we heard from Dr. Rubin and Dr. Brennan, but also some other things that administratively we're considering as well. I want to emphasize to the board and emphasize to our community again what we've been saying since July 28th and what we've been saying previously. This situation is going to continue to change. It's going to continue to evolve. the guidance is going to continue to change and it's going to continue to evolve. The guidance we have from our local health department has been revised at least 4 or 5 times. At one point, I was looking at it as a frustration point, and I've really come to realize that it is our health department that is working very hard to try to respond to all that we are learning. They are adjusting based on feedback. They are adjusting based on what we know. They are adjusting based on conditions. So we're going to continue to see the guidance evolve and change. And I know that's frustrating for everyone. It's frustrating for us as administration, but it's also the reality we're in. That things are going to continue to change and evolve. We have to continue to be measured. We have to continue to be measured because we need to be focused on the safety, but we also need to be focused on the education of our students, and that it is balancing those two things that we need to take into account as we move forward. This school year will not be normal. And I don't think in the last few meetings we have talked about even the word new normalcy anymore. I think we've really talked about the idea that we need to prepare ourselves and the reality that this will not be a normal year, that things will be very different. And just the aspect of how this guidance and everything is continuing to change will influence us as we move forward. So let me move forward for the update and share a little bit more. So move to the next slide. For tonight's agenda, just for this presentation, is brief opening overview again of what our July 28th plans were, our progressive reopening phase options, this new metrics. We need to talk about the guidance from the state, and we need to talk about the information we just received from Dr. Brennan and Dr. Rubin. The adjustment to our health and safety plan, the masking guidelines, that is on the agenda as I talked about, and administrative considerations. So we'll talk about. So we'll go to the next slide. So this was a slide from July 28th. And I was pleasantly pleased and so happy to see that, this was a slide we put out there on the 28th. We said an opportunity to shift between program models based on emergent circumstances. We are living that. We are living that right now. Collapsible cohorts to maintain social distancing and mitigate large groups. The ability to change without logistical discussions and extensive planning during the school year. We're going to have to be able to pivot between our phases. Different things will require us to pivot. We're going to try real hard to create a timetable for when we would pivot, but even whatever timetable we create, we might receive new information that may force us to adjust that timetable. I understand as a parent, you need to know. I want to know, how should I be planning for my kids in the fall? What's going to be happening? So that piece of our plan, at least from an educational standpoint, we do have the ability to pivot with the plan we've created. And I do think the plan is creative because it took into account this reality we're living in right now, this reality and the uncertainty of when we need to pivot, and that we can keep the education moving forward for our students if we should have to pivot. And it hopefully, and our plan is to have the right approach at the right time. Move to the next slide. So I'll let Mr. Dukevich Sean talk about just again, as a reminder, I think the community has seen this, but what was approved on the 28th with our progressive reopening plans for elementary.
Thanks, Ken, and good evening, everybody. So just as a quick overview, the 3-phase plan for elementary includes the first, of course, is all students full day, distant to the greatest extent possible. Also running a concurrent cyber program for online students. Lunch would be held in classrooms with minimal transitions, modified arrival and dismissal, and prohibiting visitors, offsite trips, and large gatherings. Phase 1 would be a traditional schedule with some modified specials. In phase 2, which again, in our last meeting, we elected to start in phase 2. This is an AM PM half day for all students K to 5. We can easily meet social distancing guidelines of 6 feet or more. Lunch would not be served during the day. Of course, this would mean minimal transitions, a continuation of prohibited visitors, offsite trips, and large gatherings. Amongst the AM PM schedule, we'd have a heavy focus on ELA and mathematics. Science and social studies will be done offline in the alternating portion of the day with curricular support and resources held on Schoology, our learning management system. We'd have modified specials, which would partially be online. And again, we'd include a standalone cyber program that's available in all 3 phases. Finally, in phase 3, this will be all students would transition to our Schoology online platform, and all learning would happen remote in phase 3. Students would engage with their teachers through a combination of daily live instruction and asynchronous offline activities. And in phase 2 and 3, we're looking at supervised care through our Right at School before after care provider. And I'll turn it over to Mr. Bechtold to talk about secondary.
All right, thank you. So similar to the elementary model, in all 3 phases, there is an online option for our students. In phase 1, we have all students have the opportunity to come to school and they all return. Our social distance guidelines allow us to have students in classrooms, both at the middle school and the high school, with all of them there, with 4+ feet. Some classrooms, depending on how many students are in there, will approach or get to 6 feet, even with all students there. We would have modified arrival and dismissals. We would still limit visitors and off-site trips, as well as having no large gatherings of students while they're at school. We would look to follow our traditional schedule and have cafeteria seating modifications as outlined in the health and safety plan. Under phase 2, we would have students return on an A-B schedule, and students would be seated 6+ feet in each of the classrooms. We would maintain the no visitors or offsite trips and no large gatherings. In the A-B model, we would be live streaming. So if you have the A group in on Monday, the B group would be following along live stream via Zoom, and they will be attending all of their classes just as if they were in person. Cafeteria seating modifications for phase 2 would continue. We actually have identified multiple areas around the schools and different ways that we would split students up to ensure that there is mandatory 6+ feet seating for all of our students during phase 2 as they eat. Phase 3, our phase 3 plan is for us to transition online and live stream our classes. Again, we would use our Schoology learning management system to have our students follow along. Learning for our students is something that we would have them engage every day, and the expectation is that they would follow along, that they would log in, and the teachers have worked exceptionally hard. Our administrative team has worked exceptionally hard on providing professional development. Our teachers have been engaging in it to ensure that this fall, that the experience for our students that either A, elect to be online at all times, regardless of phase, or B, those that are online every other day on phase 2 or online every day in phase 3, that they have a positive and engaging experience.
The next slide is an update on the registrations that took place last week. For the elementary, we had a 73% response rate for in-person instruction, again, based on the phase 2 model for elementary, and 27% of our registrations reflected a cyber election, again, a standalone cyber program in elementary. So 73% in person and 27% cyber.
At the secondary level, we have 82% of parents that have registered their child for in-person learning and under phase 2. So this is the A-B model. 18% have elected to remain fully remote.
So what has changed since our July 28th meeting, besides this meeting and the presentation at the beginning of this meeting? What has changed? So case counts in Delaware County has, created growing concern. It was last week at a meeting that Dr. Rubin and Dr. Brennan shared that concern, similar to the concern they shared with us today. That concern that they shared was looking at case counts in Delaware County, their concern with the start of the school year and what it could mean, how to do it successfully. Their advice to buy some time was advice that they gave to all the districts in Delaware County. So you see districts in Delaware County that are moving towards virtual. That is why. We sat together as a group of superintendents at that meeting last week with the 2 of them, with our local health department as well, discussing that aspect, discussing also the need for metrics. And there's going to be varying opinion on the metrics and guidance, which we're going to talk about in a moment as well. The concerns of end of summer travel and Labor Day has been out there as well. We heard that in the beginning as well from Dr. Brennan and Dr. Rubin. The updated guidance from the health department. I mentioned that the guidance continues to evolve. So on July 31st, on Friday evening, July 31st, we received the updated guidance. A couple of things to note in the updated guidance, and we'll make sure that is available on our website. That is guidance that we, as administrators, we're all watching very carefully and reading and making sure that we are following that, because that guidance is what's going to guide us when we open and how we handle cases. But one of the things to note as the guidance has changed and evolved is that the 6-foot distance, if you recall, in the earliest version of that guidance, there was a 3 to 6 foot. There's still some acknowledgement of that, but the reality is the 6-foot distance is much more prominent now. And as you see case counts going up, we're going to see guidance adjusting and becoming much more strict. So we have to realize in phase 2, that's what gets us the 6-foot distancing is phase 2. If that 6-foot guidance stays and stays as an important factor throughout the school year, we have to start to become ready for the reality that phase 2 may be a phase that we'll be in until we see community spread come much lower and that guidance is adjusted again. That guidance also adjusted. An outbreak was defined, and an outbreak was defined as 2 unrelated cases. So if we have 2 unrelated cases within our district within 14 days, we would be considered to have an outbreak. Now, what that means is 2 unrelated. If a student tests positive or student or staff is positive for COVID and a relative at home has it, they're living with a parent who may be tested positive, that case wouldn't count towards the outbreak because they know, the health department knows where it's come from. If there's 2 completely unrelated and we can't trace it back to another family member in the household, or can't trace it back to some known exposure, that would be considered an outbreak. And we're still discussing with the health department exactly what that would mean for us for closure. The state of Pennsylvania yesterday provided us guidance. We've been asking, and I've been looking for weeks and months, and superintendents have been asking for what is the guidance to help our decision-making? What is that metric that moves us between our phases? The state of Pennsylvania gave us that metric. We heard Dr. Rubin and Dr. Brennan take on that metric. We heard Dr. Rubin clearly state that he feels differently about that metric. And looks at that metric as, we need to take a more conservative approach towards that metric. The local health department, we had another meeting with them today with superintendents. They were looking at a metric themselves. Now that the state has shared a metric, it will probably just go with that state metric as we move forward, but they are constantly looking at trying to provide us more guidance and support, and we're hoping to continue to have some discussion with them later in this week. I have asked that question about help us drill down to Radnor specific data, Radnor positivity. That is data that right now is not available to us. So those are the things that have changed since the 28th. Move to the next slide. I think it's actually Sean that might be running the slides now. So Sean, move to the next slide. So the PDE guidance metrics that came out yesterday that we're all trying to digest. It put levels of community transmission in the county into low, moderate, or substantial. An incident rate per 100,000 residents. And you can see then the range for incident rate. You can see then the the percent positivity. Percent positivity is different than the percent within a community. The percent positivity takes into account all the people that have been tested, the negative tests as well. We are unable to do on our own, crunch the numbers, and anyone who says they're out there doing it, because I've asked the health department, it is not available for us to be able to get to crunch the percent positivity for Radnor. The only place we're able to get a percent positivity right now is for the county, as we look at the county. When I have pushed and asked, and we talked about it earlier in the meeting about looking at Radnor versus looking at the county, and we heard two doctors share their perspective on that tonight, that there is nuances to that. And there are realities to the fact that our staff, though, also work in all those different areas as well. So there's a lot of factors to take into account as we look at just Radnor data and as we're looking at county data as well. As you see here and move to the next slide, here's what we know for Delaware County. So Delaware County, we have our metric, and the metric put us right in the moderate. And this is taken right off of the state website for Delco for 5.2% positivity, and then also our incidence rate, which is the recent 7 days. And the state guidance that came out yesterday is that you are in blended or you are in fully remote. Those is the recommendation. And again, this is guidance. This is guidance, again, that's being given us by the state. We heard guidance tonight from Dr. Rubin on how he's looked at this. The one piece that has been compelling for me as I've done research and asked questions is that the countries that have been most successful in bringing kids back to school, that they started off with low transmission rates within their community. That is an important factor. As much as it's going to be important for us to make sure we're doing hygiene, screening, masking, and distancing our students, and the much as I believe we can do that well, and we can give confidence in our teachers, confidence to our teachers and our parents and our community that we can do those things well. There is also the factor of we have to look at what's happening in our community as well, and what are those thresholds, and where will those thresholds drive us? We also heard earlier from the conversation that Dr. Brennan and Dr. Rubin are open to, and they said you might want to look at, Radnor specific data on different bands. The two of them recognize the importance of getting kids into school, and that, kids need to be in school, but they also recognize the importance of maybe taking a pause and being careful that we don't open up too fast, is what we heard in the beginning. So, I've already, since yesterday at like 11 o'clock, or I don't know, it was like 11:30, 12, we received this. I've already started to wonder in the moderate, do we have a high moderate, low moderate? Where do we cut this? As much as we've wanted metric, and we said the metric and advice from our medical community will guide us, this still leaves us with a choice between blended learning or fully remote learning as we look at this data and this metric right now. And go ahead to the next slide. So we believe we need to be measured and thoughtful. Yes, the runway, as Dr. Brennan is saying, it's running out for us. We're closing in on the school year. We're all feeling that concern as we get closer to the school year. I think we need to continue to be measured and thoughtful in how we look at all of this information. We are continuing to always make sure we have an online option for our families and our students. Right now, as we look and we move forward, our options that are in front of us is we can continue in phase 2 and monitor the metrics provided to us. I think it's sobering, and we need to take into account and have a discussion what we heard from the two doctors earlier in the meeting with a decision to continue in phase 2. But we can certainly continue in phase 2, and that is an option in front of us. We can consider operating different levels at different phases based on the metrics. Looking at the metrics, looking that our positivity is close to 5, hearing Dr. Rubin say that he's got an early look tonight that the metric is possibly, that 5.2 was 6.3 last week. I have somewhere in front of me, it was 5 something the week before. What is that positivity for next week? What we heard from Dr. Rubin, it's concerning. So we could take another week to look at that positivity, look at that, where the data is trending. We could consider moving to phase 3. We could consider making the move, and that's an option for us as well, is to consider moving to phase 3 with what we know and what we're hearing. Move to the next slide. So additional considerations. We're trying to brainstorm and think about additional considerations. We believe our phases are strong and our phases are the right plan. One of the things that we had questions about and we're wondering whether we might want to consider is, do we want to consider staggering our phases? So in those 3 options I just gave, the 3 options of maybe staying in phase 2, the option of moving to phase 3 now and beginning the year in phase 3 virtually, the recommendation for at least until October? Or do we want to look at something where we try to phase in? And these are two different examples. I'll take the last example to just walk through it and realize that the weeks at the heading are different on each one. So the first option has a week 1, week 2, and week 3. And option 2 is based on 8 weeks instead of 4 weeks. And it talks about weeks 1 and 2. And I'm starting with that one because listening to Dr. Brennan and Dr. Rubin speak tonight, and they talked about the advantages of 2 weeks, the advantages of knowing and seeing things, the 14-day average and how critical the 14-day average. So one of the things that we may want to consider as a district is, do we want to consider staggering and starting with our K-2 population? There's a lot of research. There's a lot of science and doctors who would support, and even, as we discussed at the beginning of the meeting, there's a lot of rationale and potentially why we may want to start for 2 weeks with our K2 in the hybrid, an AM and PM. And then talk about weeks 3, 4, 4 and 5, and 6 and 7, phasing in then other grade spans as we move forward. So when I laid out for you potential of 3 options, this would be that third option. So one option is stay at phase 2. Another option is we say it's time to move to phase 3 and we start virtually for everyone. And we say, when are we going to, what's the time period that we're going to revisit that data? Is it through September? And then at the end of September, the board meeting, we'd make decisions on what October looks like if we're moving to phase 3 right away. And the third option is, do we want to try to stagger? Do we want to try to stagger our start? We listed some advantages on the next slide of just what the staggering and the advantages of that. I think one of the things that we need to do as a district and a community is we need to build confidence that this is something we can do. Build confidence that we can bring our kids back. We did open up this summer. We opened up for a math class and we opened up for ESY. And we learned a great deal from it. We felt that it was rewarding for our kids involved, our students involved. We felt that we were successful in doing it. We want to give opportunities so people and our staff can build that confidence. Hearing, what Mr. King shared about the numbers of our staff, hearing what other districts are going through with challenges with staffing. If we have an opportunity to stagger our beginning, whether it's the first week, maybe we stagger it the second week, and there's a lot of options on how we could do this. But if we staggered our beginning, I would hope that we could give confidence to our teachers, because we need our teachers. We will work hard to support our teachers who have, medical conditions and reasons for being out. But at the same time, we're going to need our staff. And if we have, he mentioned, I think in his email, 72 teachers, that will be a challenge for us to open if between now and the start of school, we need to replace. The staggered start gives us an opportunity for training, devotes extensive time to building our protocols again, dedicating time to navigating Schoology and the LMS at our middle school and high school. It gives opportunity for us to start virtually at the middle school and high school, which is very foundational to the whole program. It's foundational for the program moving forward, the teachers that opportunity, the kids the opportunity, because that's how it's going to work with the A and B day. The A and B days, we're going to be having kids coming in, in cohorts, and half the class will always be remote into the classroom. So starting fully could have some advantages for high school and middle school. I know it feels a little bit like I'm trying to sell that. All of us want to see our kids in, so please don't misinterpret that. But I do want to say that there could be some advantages to that. And then it allows us, the staggering could allow us the opportunity for further monitoring. We're going to have to be watching every week what's going on in the community. Now that we have a metric, we're going to have to be watching that every week, and we're going to have to make decision points on where we, each week, how we want to move forward. I'm going to end at that for right now. Potential staffing considerations. Just quickly, I'll mention those fast. Just we can go ahead to the next one. Just potential staffing. One of the things that we are trying to do is secure enough staff for at whatever point we're opening the school. And we want to support our staff that have medical vulnerabilities to the greatest extent possible. Obviously, the cyber option at the elementary gives us that opportunity. You saw those numbers that Mr. Dukevich shared with us. So we do have some opportunities to provide teachers to teach online at the elementary. We are investigating options for that at the secondary. We don't know exactly how that could look, but if there are options and opportunities for teachers with serious risks to somehow work remotely, we're challenged by that as well, because down the road, as much as we value the phenomenal teachers we have, when our students are coming in for classrooms, whether that be in September, October, whenever that is, the value of having a teacher in front of that room is important as well. So we're trying and investigating what options would be available. I did want to share with the board, just on as a side, based on our vote we did last week with activities, that we're holding off on all athletics and activity supplementals at this point. We're holding off on those because we don't know when sports are going to happen. We don't know when activities are going to happen. And what we don't want to do is start, compensating for some of those activities, athletics, and turns out maybe something's going to be running in the spring instead. There's going to be some suggestion from the PIAA. I watched as a college league is now attempting to run in the spring now. Things continue to change. So while we're in this unknown, we're going to hold off on supplementals. So I know that's a lot that I just threw at the board. That's a lot of information. I want to give some context for discussion tonight, some context for how we could go about discussing this and questions the board members may have for me or the administrative team. The motion, which is a totally separate item, we can talk about that separately. So we could talk right now, I think, about the update and where we are with this, and then we can move to that motion about the health and safety plan as a separate piece, if that makes sense. If that makes sense with you, Susan.
That's fine.
Susan, I have a bunch of questions from last time that I don't think were quite answered. I just think it would be helpful to have public discussion about them.
Sure. And you know what, I'm thinking that knowing that you were one of the last people to go at the July 28th meeting, if you'd like to start with.
Why I jumped in.
We can stop
Then,
sharing.
and I do think just for
Create the PowerPoint then, Sean. Thank you.
and just for, just to help us have an efficient meeting, I think, at least as a first pass, if people have questions, certainly ask them, but let's save comment and commentary and perspective till at least everybody's had a chance to ask their questions, because this is our opportunity to get information from our administrators and for the public to hear those questions and really to have an understanding of how very deeply we are all thinking about this. So Sarah, by all means, go ahead.
I wanted to follow up. It sounding like, given the current guidance, which I understand is subject to change, phase one is probably a pipe dream for this school year. So, I mean, it's not that it couldn't happen, but it does sound pretty unlikely. So we need to be thinking about phase two in terms of a likely option and what the costs would be associated with that. So there were questions about whether we actually have the ability, just from a timing standpoint, to clean the classrooms and clean the buses between AM and PM elementary school. And not just the staff to do that, but then also I think the board needs to understand, and the community needs to understand, what the additional cost would be for that. We don't currently run midday buses. So if we start running those, and if we had to run them for the entire school year, what would that cost be just for the buses, but then also for all the additional cleaning costs that we'd be incurring for that hybrid model of half day?
So there is. So when we proposed the half day, and as we developed that half day, it was appealing to us, and still is very appealing to us, to give structure to the kids. We looked at it from an educational standpoint, that the structure each day. We saw the hybrid half day as something that was going to be temporary. And yes, the guidance has now changed, and it is potential that we could be, and who knows, but the potential that we could be in a hybrid all year, potential that it may last just till a semester, we don't know exactly. The additional cost for our transportation for the entire year, if we stayed on a half day for the entire year, would run us about $600,000 for just us alone as a district. There could be additional costs on top of that, depending on some of our private school runs as well. So that's something that we will want to consider as we move throughout the year. At the same time, we also believe and feel that it is educationally, structurally, and from what we would be presenting to the students, within the school day, that half class focused on language arts, focused on math, 8 to 10 students with one teacher for Mr. Dukevich, how long would they be together?
2.5 hours per day.
2.5 hours per day, focused on those subject areas, we think would be very positive to our students. We're seeing good news with the cyber numbers, that we're thinking we only need 2 teachers there. So where we were anticipating many more teachers there, there may be some trade-offs with the savings as well. But certainly, as we continue to move on, we need to be thinking about and looking at those, those costs, and do we need to make adjustments down the road to it?
So just to clarify, when you say 2 teachers, you don't mean we only need 2 teachers total. You mean we'd only need to add 2 teachers to our staff in order to accommodate the cyber numbers?
Yes, that is true, Sarah. We're going to need about 26 teachers in total for the cyber program. Thankfully, the numbers fell such that each grade will have a dedicated cohort in their building. So there'll be a first grade cohort in every building, a second grade cohort. And then there'll be 2 cases where we have to have a mixed cohort because we have more than a single cohort at a school. So the numbers fell very well, and all those sections would collapse necessarily at the building level. They become cyber, and we have over 20 teachers who have expressed interest so far in teaching cyber.
Okay, great. So along the busing lines, have we looked into whether we would have busing to and from the Right at School program if there's a if there's a morning program and an afternoon program?
So Right at School investigated a number of local places, unfortunately hit a lot of dead ends. Just to give the public an understanding, to operate in any facility, they have to meet many criteria. They're essentially running a childcare facility. So there's a lot of criteria, there's a lot of costs involved. With all the uncertainty with this year, every before and after care provider are hesitant to get into a long-term contract that may not last but a month, or something like along those lines. That being said, they are licensed in all of our buildings, and we have the Eighton Lodge, which is a 7-room space that can fit up to 140 kids under normal circumstances. So we're going to be able to operate half-day care out of our cafeteria and gymnasiums because they will not be used by the regular population during AM or PM. So we will be able to do that at each building. So busing to a different facility will no longer be necessary.
And the Eighton Lodge isn't where we currently have the DCIU giving classes?
No, we've actually used Right at School in that space before, and otherwise it's been largely empty.
And I just missed it, or maybe you didn't say it, the actual costs for cleaning and the ability to clean the buildings and the buses between the morning and afternoon.
Yeah, I know Mr. Dolan is on here. He may jump in about the cleaning. We had a presentation today by our cleaning, our director of cleaning that works with all of our custodial staff, and reviewed how that would be done during midday, and also kind of throughout the day, and making sure all the high touch surfaces are cleaned, bathrooms are cleaned on a rotational basis. And then during the middle of the day, we have 90 minutes to clean the classroom spaces. And then just to give context, normally a classroom would have 24 desks, have a lot of touch surfaces. We've removed a lot of furniture from classrooms. Instead of 24 desks, we're going to have 10 to 12 at the most. We're not moving around the building and transition to different special classes. That's being done a different way. Our students are not moving into cafeteria or gymnasium or the library. Those things will be coming to them so we can mitigate exposure and keep our cohorts intact. So the amount of cleaning just by nature is going to be smaller because, again, we're in cohorts. All the cyber kids coming out, we're talking about over 400 children will be on cyber. So those rooms will be empty. Those sections, at a first grade section at Radnor, would no longer need to host students. So yes, we may spread out and have what used to be small group rooms move into larger spaces, but we have a plan for cleaning midday and then throughout the AM and PM rotation. and then also between the AM and PM runs on the buses, which you saw a snapshot of in the video. I know Bill's on here if there's any further questions about that though.
And so we don't think there's going to be a significant additional cost because that staff is already on site during the day. I feel like a lot of our cleaning staff is actually usually only there at night.
Bill could speak to that, what we're doing with shifting from the night, from the afternoon shift to the day shift. So I'll let Bill comment.
Correct. Perfect timing. Somebody's using a blender upstairs just as I clicked on, but I think it's over now. Sean, I think you covered it pretty well. And Sarah, yes, some additional staff, but what we've been doing is Duncan Smith's been working very hard over the last 4 or 5, maybe even 6 weeks now to build up. Basically, it's our sub pool to pull from, so that we have the ability. So these are not full hires, but people in our sub pool that we will use and have used throughout the year. And then we're going to bring full-time staff down. Each building might be a little different. Maybe it's 2 for one building, 1 in another, or maybe even 3 in the high school, and use them staggered through midpoints. The 2 things will go on. One would be someone sort of almost systematically, but going through to just and hit high touch surfaces. And as Sean described, will be thinned out a lot. So there'll be an opportunity to move around into empty classrooms, empty desks, spaces that are spread out, and just hit high touch surfaces throughout. And then on those A/B schedules in the elementary schools where we are going to transition between, we can then go in and clean classrooms. It wouldn't be the same kind of a cleaning that we would do overnight because it would need to be. But we would hit them hard between the morning and the afternoon sessions. And then we would still have our full staff on in the evening to do the thorough clean that we would normally do. Does that make sense or answer your question? I haven't put maybe a cost on that yet.
Yeah, that's what I'm hearing, that we don't have a number, it sounds like, yet on that.
Not yet. I mean, we're working on it. We're still kind of working out the details of all of that. I think that's something that we could have in the next 2 weeks.
Okay. And then Bill, you and I, we talked about this briefly earlier today, but I think it was raised in a couple of comments, and there were 2 issues raised. One was eating lunch inside. There were a lot of parents who wrote in and said, I don't want my kid to have their mask off in a classroom, but I'm wondering if they were thinking about the fact that at lunch, the plan is to space kids 6 feet apart, and they're all going to be eating. So I guess my question was, and I know your answer, but I want everyone to hear it, are we considering outdoor lunches? Is this something we can facilitate at the middle school and the high school? And especially because, the issue another person raised was ventilation, and we know this, we have some, 1 or 2 older buildings. And my question is, we know there's no air conditioning in the gym at the high school. So if we're trying to turn that into a cafeteria, what's the ventilation like in that space? I heard, I think it was Dan say there might be some different, we might send kids to different spaces, but I think that would be something worth really understanding when kids have to have their masks off to eat. Where are they going to be? How well spaced are they going to be? Are they going to be in well ventilated areas?
So, that's a great question. So the question of the unair conditioned, like the auxiliary gym or the main gym, we're still working out what the space, what the best layout in the space would be. And then I believe we can get air exchanges in there, but we don't have an air conditioning system in there. So yes, in September, it could be, if we have some uncomfortable humid days, it doesn't mean there's not air in there, outside air in there. It just means that it's not cooled air. So we're still investigating that and working on layouts. We literally go through probably, well, we didn't do it today, but yesterday and several days last week, each building, and we tweak the models. So we're working on that. Is your question specific on eating lunch or just HVAC in general?
Yeah, no, I think lunch specifically, because the concern is we know they're all going to have to take their masks off to eat. And I guess the question is, why can't they be outside?
Well, and we are looking into that, the cost of tents and how long you would have them, and then do we have to get into tents that can have heating and air conditioning if we were to get into the colder months? Can we put them on the ground even when it's raining? Those details have not been worked out yet, but we are talking them through. So I don't know. Yeah, go ahead, Ken.
Yeah, I was just going to jump in. I mean, we've been looking at tents and those options, but keep in mind, by going hybrid, by cutting our population in half, it gave us, and going AM, PM, where we're not having the kids, we're not feeding the kids, gave us a lot more opportunity. So, cutting the population in half at the middle school and high school is making it a lot easier for us to social distance 6 feet or greater, and still have lunch. Versus if we had the whole population there. So just by going to the hybrid, we're gaining efficiencies and space so we're looking at the tents as a possibility. We'd love to get the kids more outside as well. But we also are gaining a great deal of space by just going hybrid. Does that make sense?
It does, except that to the extent the board feels like kids in classrooms seated at a desk who are 6 feet apart, that a shield isn't sufficient. Presumably eating your lunch 6 feet apart without a shield is less protection. So I guess my question is, is it only going to be 6 feet, or can we get 8 or 10 if they're all in a gym, and is the gym well ventilated for that purpose?
So I'll jump in here. So Mr. Dolan and Mrs. Kevigus and I walked the building this week. We have been working on it for some time. As he said, the district is looking at tents for different buildings, and we've actually gone as far as pricing it out from a couple different places. We've also identified opportunities for outdoor seating at the high school, looking at the courtyard area. We have Adirondack chairs over in the other courtyard area that's near the academic wing, and we were looking at possibly procuring plastic Adirondack chairs. That's a very huge courtyard over there, and so we've been looking at using that. Again, that's weather permitting. We looked at the black box and how we could socially distance students in the black box and shutting that down only for lunches. We're anticipating 6+ feet for the students in the cafeteria, which would get us between 70 and 75 students. And if you've ever been in the high school cafeteria during a normal year, you can get like 400 some kids in there. So we are really looking at how can we go and make it as socially distanced as possible, in addition to using our auxiliary gym. We've talked about having monitors if we would need to, if it's a nice day out, to take the students over to Loop Field and having them eat over by the softball field. So there's a lot of different things that we have been considering, and to the greatest extent possible, we're going to have opportunities for students to eat outside. But if they are eating inside, we're going to make sure that they are distanced to the greatest extent possible.
And I apologize, I had one last question on busing that I forgot to ask. It seems to me, I think a lot of our hopes and plans for the busing are based on an assumption, and I think it's probably reasonably based, that a lot of parents are willing to get their children to and from school. In the past, we've had a standard program where everyone is guaranteed a seat on a bus unless you opt out. My question even with phase 2, is that still the plan, or are we going to change, in which case I think we need to give people notice, to an opt-in program where you only get a seat on the bus if you tell us in advance that you need one. And I'm wondering, specifically given the additional costs for transportation, if that wouldn't be prudent, especially given all the private schools who, to our knowledge, are going to be opening and operating, and therefore may have students who need transportation. And I guess ancillary to that, do we have an obligation to provide busing if we're closed in phase 3? I mean, not closed, but if we're in phase 3 and operating only virtually.
So I'll jump in about the virtual. I believe if we're virtual, not running buses, I'm not sure we do, but I'll check on that. I don't know. I'll talk to Michelle and Mr. Hearn about that.
Okay. How about the opt-in versus opt-out?
So one of the things that I'll jump in on here. So one of the things that we did when we did our registration was we had I'll say it's a system that was, if a family chose to be hybrid, then they got prompted to make a decision and register for busing. Are they going to use busing, or are they going to drive? If a family registered for cyber or virtual only, they did not get that. And so we're using that data to go through and make sure that we know how many students are going to be using our buses. And one of the things that we had talked about at our previous meeting was making sure that we could pivot if we have a student coming back from cyber and going to in-person. And we talked about the time that it would take for that. Part of the considerations we're looking at as administrators is making sure that if we need to have a student come from fully virtual to hybrid, that we've got a seat for them on the bus. And so when we talk about the timeline for that, that's one of the things that we took into consideration as administrators.
You just outed me as someone who registered my kids to attend online. Or I outed myself by not knowing the answer. I guess my question is, though, should we consider an opt-in program, because we could certainly save district costs by ensuring that we're not planning to bus anybody who doesn't need the seats. I'm looking for ways to cover the additional cost, or to mitigate the additional costs that are coming with some of this.
Yeah, and that's something we can talk about and look at, I worked at a district that cut a kindergarten midday run in 2008. And I'll be honest, it was seamless. Parents figured it out, carpools, and it was done. So I think there is a lot of things that we could certainly look at and discuss. If that financial impact became a concern, there's a lot of options we could look at.
Okay, I'm just thinking in terms of a lot of the private and parochial school students, if we were going to change that, we would need to make sure we got that kind of notification out pretty quickly. And my guess is that a lot of them are not going to want to ride the buses. So it would be better, the way a lot of parents in our, at the public schools have decided they would transport their kids. And it would save us a lot of money not sending buses for people who aren't going to ride them.
Yes, would.
Thank you for answering all my questions. I really appreciate it.
Great. Is there anybody else who'd like to jump in with some questions? Okay, I actually have a couple. And I'm going to assume you guys are still working this out, but there have been a few questions about what the kind of the length of the day or the academic program is going to look like at the elementary level in this AM/PM model, or frankly, even the virtual, even if we had stayed with the AB model versus the full cyber academy. So, some parents will probably would think the cyber is too long. Some people will not. Some people will think that the hybrid is not, long enough, robust enough. So I know that you've been working on it. I know this is a work in process, but do you have any kind of firmer information about what that will look like? What two different elementary students, two first graders, two third graders take it, one cyber, one's hybrid, what that might look like?
Yes, so Susan, I tried to capture that into previous, it's probably too wordy, but essentially in a typical day, if you boil out, all the time and how it would work with the cyber teacher meeting with small groups of kids based off their reading level, their math level, it comes out to between 2 and 4 hours of time each day that students are actively engaged with their teacher.
Okay.
So not that different than a 2.5-hour in-person day with a semi-hybrid second half where specials and social studies and science are situated. So all things considered, they won't be very different. Of course, both programs are on Schoology, our learning management system, have been built out. So the content, the scope and sequence, all the curriculum, it's identical. Obviously, teachers will supplement and they may choose a different book to achieve the same learning target or choose a different activity to instruct the same topic. And there'll be subtle differences around that, which is common in any classroom setting. By and large, the amount of instructional time should be very comparable.
Okay. Thank you for that. So when you were giving us the information on the numbers of students who at this point families are opting for virtual, or their preference for the virtual learning versus the hybrid, I thought I heard you say that about 75% of the elementary school students at families had responded. Was that accurate or close enough?
Oh no, we have actually just about almost 100%. Right? Okay. We're literally in a few in each building that we need to confirm with, but we're very close to 100% registration at the elementary.
Right, so how much wiggle room is there in terms of needing 2 staff members to do the cyber program or 2 additional staff members to pull off, how much wiggle room is there in terms of if people do the on-ramp, off-ramp options?
There is some wiggle room. Frankly, we wouldn't necessarily have to add 2 staff. We're just trying to be very close to our class size guidelines. So in a couple situations, our cyber registrations would breach the class size guidelines that we do for in-person. For example, if a school had 23 registrations for first grade, that would exceed our class size guidelines for first grade by 2. Normally, that would indicate an additional section be added, and then you redistribute those kids amongst those additional sections. For cyber, arguably, you could run a cyber with 23, but we're trying to maintain those guidelines. So in those cases, in kindergarten and first grade, we have a situation where each school would have a size close to the class size guidelines, and then that much more that we would have to pull together into a mixed cohort. So, but we have built in cohorts that have room to add kind of onboard and offboard as we need to.
So what is it about cyber that we don't think that you think the argument could be made that we could exceed a class guideline?
I don't know that we want to exceed class size guidelines. I don't want to give the wrong impression. I just think operating and managing students online is a different dynamic than in person. We all recognize that. In some cases, you're not managing some things where they're physically in the room and spatially and all those kind of things. So arguably one might be easier to manage a larger group than another. But again, I feel like the best thing to do is to be as close to our class size guidelines as possible.
Yeah, yes, I would. Yes, I think it would be challenging for us as a district if parents feel that that one selection has an advantage over the other from that regard. And then just to be clear, if we're still basically encouraging families who have made the standalone cyber option, their selection, if we're still kind of asking them to do that by trimesters, by marking periods, correct? I mean, they can change, but we've asked them to kind of commit by marking period. Is that accurate?
That is accurate. We asked them to make a trimester commitment with the understanding that if they requested a change, they would give us a 1 to 2 week grace period to make arrangements and make sure everything is prepared for that child.
So as you're making class assignments in the elementary level, you're kind of thinking about some level of wiggle room to be able to, because if I'm in the cyber academy, by necessity, if I want my child to segue into a traditional classroom for the hybrid program, they'll have to get a new teacher because the standalone cyber teachers are standalone teachers.
Yeah, that is the one, if you want to call it a negative, if you change from standalone cyber to in-person, the child would have to change a teacher.
Okay. All righty. And Sarah kind of touched on this, but just.
And Susan, just to add on to that, it is our Radnor program created by our Radnor teachers and both being taught by our Radnor. I know, just wanted for people listening, make sure they understand that.
Right. Well, that actually speaks more to, I know you all have said it, all summer long, and I'm so grateful for all the work. And even when the president of RTEA referenced this, the teachers have been undertaking, professional development this summer to enhance their virtual. So, that just speaks to, reinforcing that the virtual remote program is not, people should not mistake it and think that kind of what we were able to pull off in the spring is what's going to happen in the fall. I'm just trying to run through kind of here's something we have not really touched on really at all, but the implications of the immunization waiver. I know a few parents have reached out to us via email with concerns about the immunization waiver. And I guess my question is, are we still trying to approach, well, it's kind of a two-part question. How does our registration for students across the district, we're in August. Typically by now we get registration numbers. This year we've been very focused on who's in-person versus virtual, but I'm kind of curious, how's our overall, student registration, student population going? What's one question, but it's coming about in my mind because of the immunization waiver. Are we still trying to approach our student registrations with the mindset of we really want kids to be immunized when they come walking in the door? So kind of how's that going? I know you all want to jump in with the answer.
The immunization waivers we need to look at more, and that is something that I had a conversation actually with Mike Kriskofko, our solicitor, about those changes and how do we as a district want to respond to those pieces, and that's a conversation we need to have. As to the enrollment trends, we may have to get back to you on that. I don't know if Sean, if you have any information at your fingertips with enrollment trends. Not again, what we're looking at with cyber versus in class, but actual overall enrollment trends. And the same with Mr. Bechtold. I don't know if we have at our fingertips right now to be able to share with you. I can tell you off the top of my head, but I don't want to misquote where we're looking at right now.
I can certainly look some information up and get back to you in a couple of minutes as I'm working here, but I can tell you.
My guess is that you're not jumping up with, oh yeah, we saw a big, there's probably likely not huge spikes. I think it probably would have stuck out.
We've held to, at least in elementary, we've held to the same general number of sections that we have. We are a little bit lower in kindergarten registrations right now. I think people have waited to see.
Sure.
We have, in full transparency, we've had some kindergarten parents rescind their registration for kindergarten. With their outlook being that this is not going to be a good, in their opinion, first year or it's an unknown year. Obviously, we want to make sure that our kindergarten experience this year, regardless of our circumstances, is as great as we can make it. But in many people's perspectives, they're going to elect to kind of redshirt their kindergartner, and some have elected to do that. So our numbers in kindergarten are lower, but in our other sections, we're essentially where we always are, or have been at least in the last couple of years.
Okay, great. Dan, this question is, I'm going to ask it, but I'm not expecting an answer. I just kind of want to throw this out there. I was speaking with one of the high schoolers today, and this student is, I believe, registered for a hybrid, but it was kind of a unique approach to it, in that the family was kind of wondering, well, I think they were really on the fence, quite honestly, about virtual versus hybrid, but apparently there are some courses the student is taking that are really best suited to be in person. Maybe it's a lab, maybe it's some course that hands-on manipulatives, being in school is really better. And actually the student was wondering, are they kind of able to be a hybrid student, but just come in for the classes that require the hands-on and participate as a virtual student for their other courses. Some courses lend themselves more easily to, being completely remote. And this particular student was kind of coming at it from the perspective of, trying to balance, right? Trying to have access to the manipulatives or the hands-on experience of the particular course that they're taking, but also wanting to minimize their exposure at school in terms of, just being around other kids if they don't need to be. So I'm not asking for an answer, but it's more of a, I guess it's kind of a hybrid of a hybrid, coming into class for the classes that really are best done at school. So I just kind of throw that out there as a thought or a consideration. And I still think there's some confusion out there about if you choose the virtual selection. Now, we haven't made final decisions about all sorts of activities, but I think there might still be some confusion about options if you are selecting virtual, what activities can you participate in or not participate in. Just trying to think of the last question this particular kid had. Oh, it escapes me. That was it.
And And just to, I'm just looking at the time at 10 o'clock and, you know, we had the presentations at the beginning and we have the options of, you know, are we looking to, you know, I think these nitty gritty questions are really good. But are we at a point where there's, I think we need to talk about the options and what do we want to do next week?
Sure.
The options of, we stay at phase 2, the option of we move to phase 3, the option of C, which is other, and I gave one example of what other could look like. So, what are the questions in related to that that we need to move us for a discussion next Tuesday? I would recommend that we have a discussion next Tuesday. I think the runway is running out. I think we need, that would be 3 weeks notice. I'm losing track of weeks and days, so I could be off, but I believe, is it 4 weeks still next Tuesday?
Oh, no, next week's 3 weeks.
Yeah, next week, yeah. So if we make the decision, we're giving our families 3 weeks notice. If we are adjusting from phase 2, same with our staff. If we are looking at some type of a staggered approach, and there's a lot of different permutations that could be looked at with that, or if we're looking to stay at phase 2. Maybe have some of the questions focused on that piece. What additional information would the board like to have between now and next Tuesday? And my recommendation would be to have a meeting next Tuesday to make that decision.
Okay, great. I mean, I, with that in mind, do you see Liz? Yes, go ahead,
One
Brad.
additional information that I'd like to have is, do we think that we'll have those Radnor specific community numbers by Tuesday from the Department of Health? And perhaps, and how far back are we going with those numbers? Are we looking at, because I'm hearing a 30-day trend, like, so are we looking at 4 weeks worth of numbers? And have we requested, or could we request, surrounding zip codes as well? So we're just not looking at Radnor. I mean, we are at a point in our county where we're right by Montgomery and we're also right by Chester. So do we have some surrounding zip codes that we could get as well?
I will do my best. I have asked for that, and I'll see what else, other additional information I can get from the health department. I will do my best.
Susan, I had a question from last, I'm sorry, Andrew, I see.
I just want to ask just a couple of quick questions from the presentation. And very brief questions about the survey. How was the exact question worded? I guess maybe not use the word survey, but the question on the registration form. Was the question posed as in-person versus cyber? In which case, that would kind of conflate or kind of elide out hybrid. So, I mean, how was it worded there on the registration form?
So Andrew, they were choosing at the time between phase 2 and completely cyber. So
Okay.
the AB model at the secondary, or cyber entirely, or the standalone cyber, or the AMPM.
Okay, so they were saying either hybrid or online. Is that right?
The way we issued it was the current board approved plan was for the phase 2. And they were selecting between standalone cyber or remote at the secondary levels, or the hybrid version of each.
Okay. All right. And then just a couple more questions. I know I brought this up before, and I've discussed this with Susan offline, and it may be kind of late in the game, but I feel fairly
Wait,
strongly.
is this it's a question?
It's a question.
Okay,
Yep.
good. I just checking.
Sure. So I was just wondering, could we switch around the order of the phasing? So in my opinion, phase 1 should be online, and then phase 2 hybrid, phase 3 in person. And it just reflects, I think, an attitude about, what should come first. That's a general question. And finally, I've heard a lot of questions about how teacher assignments will be affected by whether someone chooses hybrid or online. So for example, if you choose virtual, how will that affect who is teaching your child? How will that affect, let's say you're requesting a particular teacher for your child. How will your choice of doing hybrid or fully virtual kind of affect that?
I'll jump in at the secondary level, if that's okay, Ken. So secondary level, number one, we don't allow teacher choice. So we don't let our teachers pick their students, and we don't let our students pick their teachers. So, but the way that it works with the hybrid model with the AB is that a teacher is assigned, when we build the master schedule and the students are placed in the class, those students have that teacher when the schedules are released. And if they decide to, if they're the AB model, on day A, they have that teacher first period, and day B, they're at home. If they're a fully virtual student, they're still placed in that class. We built the class agnostic of where they were selected. So we just built the classes based on the simple tallies and where the students actually, what they selected. And then this thing that's really nice about the middle school and high school model is that it doesn't matter if a student chooses online, fully online, or if they choose the hybrid, because they're assigned to the class and they're either going to be in the class on the AB schedule, or they're going to be online. So at the secondary level, student schedules do not change whatsoever, regardless of what they choose.
I would add at the elementary level, again, just as Dan said, each building does placement. Most times a building principal will say, I cannot guarantee any kind of request, just because it's impossible to do that and honor each one. We have, over 20 teachers I mentioned previously who have shared an interest in teaching the cyber. So naturally they will be pulled out of the in-person, they would be out of the pool of teachers who would be teaching in person. So at every building, there's at least one, sometimes in Radnor's case, we have 2 cyber cohorts in 3 grades. So based off of teacher preference, again, we're looking at how we can support them with any health vulnerabilities. And if they're placed in a cyber, I don't know if parents would sway between cyber and in person just because the teacher may not be in person. That's a good question, Andrew. I haven't thought of that, but right now we're just looking to see who would go cyber and what teachers are interested, how can we support that interest, and see how things fall in place after that happens.
Great.
And Andrew, to your question about the phases, I mean, actually, it's a good hindsight comment. At this point, though, I wouldn't recommend changing, only because
It's out of the barn.
yeah, exactly. We just become too confusing. But I see the logic behind your point.
Okay, thanks.
I know Bradley I think you had a couple of questions, and I see Nancy does.
Sure. First question, you talked about, Mr. Batchelor, what's the sense of the board next week? What should we talk about? Should we talk about switching to phase 3, staggering? That's not an either or, right? We could decide both that we're starting in phase 3 instead of phase 2, and that after whatever the cooling off period is, we could start staggering from that period. So, October 1st could start a staggering session along those lines.
Correct. Yes.
Okay. And one question about the phases and the potential childcare option for elementary students in our buildings with Right at School. One of the great values of the elementary plan is students are with their cohort, their teacher, one teacher, the entire morning or afternoon. What is our capability to keep those students cohorted if a subset of them are either continuing or starting the day with Right at School? And I did understand, I think correctly, that we're looking at larger spaces where students would potentially be mixing more. But is there any way we could also try to limit additional mixing that would happen at Right at School beyond the elementary cohort students would be entering into or leaving from after their elementary program?
Yeah, great question, Bradley. Right at School has assured us they will follow our entire board-approved health and safety plan. They will put in all parameters, guidelines that we have in place in the building. And of course, they're going to want to keep cohorts and mitigate exposure as well. Unfortunately, that we probably will have to have a limit on the number of students who could be registered, and they'll have to have a wait list after that, because there's only so many students that we can accommodate in those spaces during the day when other kids are in place, and also maintain socially distance parameters. So I think once we know our AM and PM placements, and those are shared out with parents, then right at school, we send out an interest, or we are sending an interest out today. A formal registration link would come out after the AM PM placements are made, and that way parents can register for whatever opposite, if they wish to, that their son or daughter would need care for the other part of the day. And then right at school then would look at what the class placements are and make sure that those cohorts remain as closely intact as possible.
Thanks. And also in the spirit of, cutting down on mixing outside of the classroom, at the secondary level, there already is a lot of mixing in classrooms as students move from teacher to teacher. To the extent we allow athletics, I know we don't have to answer this now, and Mr. Batchelor, I've raised this idea with you before. It's a converse of a question we got last week. If my student elects all online, would they be allowed to do athletics? What would it look like to make the default option for a student who really wants to do athletics the online option? So if you're going to choose to take on the extra risk and mixing that could happen with an after-school sport, would you agree to have your program in the classrooms be the online program? And one thing I love about the secondary program is the flexibility that exists, with being able to come in and come out. So for the season, for the sports season, maybe plus 2 weeks after, would you consider a policy where the student is online during the time that extra mixing?
We could certainly consider that and look at that, and and I'd be willing to circle back. I did not get a chance to ask that specific question, but that's a question we could ask to either Dr. Brennan or Dr. Rubin as well, their thoughts of that as well. I mean, a lot of it depends on what is our athletic program, and we don't know right. If our athletic program is intramurals, that's a non-issue. I think that we need to be. Dr. Rubin's comments did resonate with me about the importance of athletics and activities. And if sports don't run, what do we do as a district? And I think it's another opportunity for us to be creative, another opportunity for us to look at how can we problem solve and provide some type of option. So I think once we know what it is we're doing and what it is at that time of year, I think that is a consideration we could certainly have and discuss.
And my fourth and last question, I've been impressed with how the administration has adapted to the teachers unions safety requests. And we've made this commitment to 6 feet and many other things. And I know we have a masking motion we'll potentially consider later as well. There was one new safety request today. Mrs. Duffy commented on it briefly as well. This idea of a 30-day average instead of a 7-day average or a 14-day average. Whether you have a reaction to that now, I think that's something worth looking into. If you have a comment on that now, I think that'd also be appropriate.
Yeah, I will, I will bring that back to, weekly meetings with some of the doctors I'm meeting with. Their guidance right now has been the 2 week, has been the 14-day average, has been the guidepost, but I'll certainly bring that back.
All right, thank you for your hard work and especially your flexibility as everything's been changing.
Nancy, did you say you have a question or two?
Yeah, only one or two. My first question is with the staggered approach, given the question that we should be asking questions about those 3 options at this point, the staggered approach, did we consider, and I go back to what I've mentioned before, transition years I think are important. Did we consider including like 6th grade for middle school? And 9th grade for high school, maybe just including them in those first or second phases along with the elementary age? Did my question make sense?
It does make sense. And Dan, you can jump in too. I mean, at different points in our planning, we certainly looked at those transition years and what could we do creatively and differently. We didn't specifically look now at those with this, we specifically looked with the stagger K2 because of the research on, and some of the research specifically out of South Korea, other research about younger students and their ability to, and Dan can speak to this, he's done a great deal of research, but that staggered approach had a lot to do with the safety and the acknowledgement of that age of students and what we believe is going on with, the virus in that age of students. So it would, so that was the focus, and then ninth grade wouldn't fit that, or, and sixth grade would maybe fit it more closely. Dan, other pieces you wanted to add to that?
No, I think that, I think we spoke about this at a previous meeting, really looking at the students that are 10 and under, and the fact that the research shows that they don't aerosolize it like the adolescents do. And so that really led us to, we felt more comfortable bringing back the K to 2 students much more quickly. I don't think that your point is lost, though. One of the things that, we looked at with the 6 through 8 band and the 9 through 12 band was, staggering it. But, those are just 2 concepts. And so we could certainly go back and look at the drawing board. Maybe we, as an administrative team, maybe we modify it and look at, like, do we phase in 6th grade prior to 7th or 8th at the middle school or 9th grade? But we really looked at grade bands specifically for the week 1 or week 1 and 2 for K to 2, and then building it up as the students matriculated and aged.
Yeah, and that approach does make sense. I was just wondering, given transition is such an important time for, a change for this age group. Just interesting to think about. And then the only other question I have is, I know that we're with the cohorts in phase 2, we were looking originally at breaking that down geographically. Are we still planning on doing that just to contain, like, for better containment? Is that?
So we looked at a couple different options, and we are working to finalize ours. So right now the goal is to try to break down how many students we have in each individual building at a given time. And so, I know that Mr. Dukevich is working at the elementary level. We've worked already with our transportation, looking at both alphabetically and geographically. I'll say, tentatively speaking, at the secondary level, we are looking alphabetically, just based on how it breaks and making sure that we can get the kids, the classrooms right and the number of kids in the school right. Again, that's not a final decision, but that's where we're leaning right now. And we did, break down students 6 through 12 and looked how many they were and what we do with households that had multiple students with different last names and how many of those there were. And then the next step, as we're finalizing the master schedule for the middle school and the high school, is to look at what do the class sizes look up under those that makeup. So there's been a considerable amount of work. So far, it's led us to believe that the safest way to bring the students back and the most efficient way for us to do it is alphabetical. And so that's kind of where we're at now. Again, but we haven't made a final determination that we would say this is what the alphabetical band is to parents, but we anticipate that we will have that shortly.
All right, thank you. I know there's so many variables to deal with deciding that, so I was just curious. Thank you.
Amy?
Yeah, I know we discussed this last time, and there's one question that we didn't get a chance to. Maybe I'll start with that one and see if Mrs. Lesage, I see her name there, but I'm sort of thinking she might be able to answer this because this was part of her presentation last time. I think if at some point in time we are all virtual, and maybe even if we're not, the thing that comes up for parents and students is social emotional health. And I know that there are a number of resources that were put before us for the July 28th meeting.
Go get it.
Uh-oh. Mrs. Lesage.
Amy, I'm sorry, you had a question?
Yeah, I didn't know if she was answering or there was something else going on. So I was just curious, is there going to be any sort of proactive surveillance to make sure that we are, hi, Mrs. Lesage.
Hi, how are you?
Good. I'm sorry, I've had this question since the end of July and I wanted to ask you, you have a tremendous number of resources lined up that you presented to us on July 28th for what to do to help support social and emotional existence for students. And some of them look like many of them look like they are reactive interventions if there's a problem. But I think I saw, and we didn't get too much detail on it, some proactive interventions. Could you briefly describe any kind of surveillance oriented types of things? Because if we are in a remote situation, I know that it's a big concern among parents about how students are going to be socially and emotionally. So do you speak here a little bit to training and support that you're going to be offering for students and parents and teachers? And I was just wondering if very briefly you could talk about that so that we could have a sense that there's some proactive surveillance perhaps going on. We can maybe prevent some of that before, instead of having to deal with it once it happens.
Sure. So I guess surveillance, one of the ways that we're really looking at our students, especially when they're not right in front of us, is through attendance. So that's probably the biggest, way of knowing exactly what's going on. And the attendance that we're going to be looking at is through our students logging on, through them being able to complete different assignments and having that interaction that we're going to be doing, which is going to be more so this time than it was in the spring. We also have and continue to utilize Terry Erbacher, Dr. Erbacher from the DCIU, who is our consultant on our risk management and basically our CSTAG, which was the entire system we put in for really looking at doing risk assessments and knowing where our students, our families, and our staff are while we're working with our students. So if those the type of things you're talking about, because that was a big piece of what we're doing. We're also starting and kicking off the year August 31st with trauma-informed kind of like self-care for all of our staff. And we're going to be utilizing this, it's called Springfield Psychological. We're going to be utilizing them throughout the year and trying to set up times for them to provide some services for our students as well. So we're going to start off with our staff on August 31st, and then we're thinking it's going to be sometime, we're hoping around November, he'll be able to be providing some of that self-care for students at that point. Is that kind of what you were talking about, Amy? I'm not sure.
Yeah, but I guess just, teachers being trained to be particularly attuned to signs outside of just attendance for students who may be feeling
sure. Okay.
lonely, isolated, whatever, that kind
right. Absolutely. So they are part of the training in that. We're not only retraining our teachers with that and have done that throughout the spring, we also are providing continuing training for our paraeducators. Our paraeducators, as we started being online, were involved with our students in a much more personal way and through going online and assisting their individual students if they were a PCA or a personal care assistant for a student. Those paraeducators have been trained also again by the DCIU, Dr. Terry Erbacher, as well as our BCBA, Jackie Santalupo, and our emotional support teachers in understanding and looking for signs that students may be exhibiting, basically in person, when we get all back together again, as well as online, looking and noticing trends that students are having while they're working with them, and then knowing the different processes that they have to do in order to make those referrals to the correct people so that we can start the process with our trained staff, our psychologists, our school counselors, as well as our people from the Karen Foundation, our licensed counselors, mental health counselors that are assisting our staff as well.
But would you say the pedagogy is going to also be looked at through a how do we build a sense of community, even when we're not all together kind of thing? Maybe more activities designed around fostering interaction when you're not in person with each other?
So we actually started it off today. George and I, before we started our admin retreat, we had our school counselors, we had our licensed mental health counselors from Lakeside, we had our social workers, our emotional support teachers, and also we had Mrs. Miller, who is the coordinator for special ed, that worked together to produce a whole array of teaching and learning activities that will be shared virtually with all of the teachers within the district. So they just started that today. We kind of kicked them off and then they continued. We got a couple of things from them. I think they did a really nice job, but that is going to be continuing, and they're going to be putting it on different platforms, whether they've decided to do it on Schoology to share it out with all of the teachers, or whether they've done it on our, our folders, our interactive folders that we have. So that piece was started today as well to continue throughout the remainder of the school year.
Okay, great. Thanks. I'm glad I asked because that sounds like something that I
It's
imagine
yeah.
SEL is top of mind. You want to get down into the drills of biology or algebra or whatever it is, but I imagine SEL is at the top of the list because these are different times in which we're educating students.
Absolutely. We've got a lot of different interventions, and we're trying to get as many of our staff to be working on different pieces and being able to push it out to all of our teachers, our regular ed teachers, special ed teachers, and also our paraeducators.
Okay, thank you. I appreciate that.
Sure.
I've been wanting to ask you about that, and I know that that's a big issue for a lot of families. And then the only other thing I wanted to just ask a technical question about the temperature checks. I hadn't thought about it until we heard the doctors tonight, and I may be mistaken, but I thought I heard them say something about universal temperature checking or whatever. And I know that there are apps out there. What is happening with parent taking the temperature at home? Is there any way that we're monitoring how many students have come into school with having had their temperature checked? Even though that's not necessarily a sign because you have asymptomatic folks, but it seems to be a protocol that, whether you're on a college campus or anywhere, that people are asking you, anywhere you go today, pretty much people are taking your temperature before you go in a building. So how are we working that protocol again?
So right now, and Todd, go ahead, jump in if you want, Todd, but right now that protocol is that we're going to look for parents, but we are also going to be doing checks as well in the buildings. And we have been investigating different apps and different opportunities where it's a quick check off that, temperatures were done each day. But I'll let Todd, did I just summarize that quickly or jump in, Todd?
Yeah, basically one of the apps that's in the front running for us is each parent or staff member would go on in the morning, answer a bunch of questions. If it's green, they can come to the district buildings. If it's red, they should be staying at home. And if we want to, as they're walking in the door, we can have them show us the phone if it's a quick green red, just to do a verification. And then we're also talking about having nurses randomly check student temperatures in the building while they're coming in.
Okay, great. I love the idea of the app. I think that's a good development there. And the last question is, somebody had raised the question about IEPs and 504s in terms of the cyber options. I assume that that's something that'll be worked out with IEP teams. If your child has an IEP or a 504, you should talk to your case manager to figure out how that is going to be accommodated in a remote situation.
So absolutely. It's all going to be decision made. Actually, George and I are presenting to the entire educational admin team tomorrow to go over the exact process. We are then having another Zoom meeting with all of our learning support teachers on Thursday. And then I believe it's the 18th of August, we're going to be trying to put together a live webinar for all of our parents to go over some of the different things, what it's going to look like as we move into the fall. And again, it's going to be very interesting as things keep changing. So we'll probably be going over a couple of different things that could possibly happen, so we can try to cover all of it. But that's really what our plan is moving forward. But yes, absolutely, IEP team decisions moving forward.
Okay, thank you.
Sure.
Thank you. All right, so we're going to move into our priority action item, which is item 6.1, approval of an adjustment to the health and safety plan passed on July 28th, 2020. And the recommended action is that the board approves an adjustment to the health and safety plan passed on July 28th, 2020, which will require students to keep masks on while seated at desks that are socially distanced at 6 feet or greater. And do I have a motion and a second for this item?
So moved.
So moved. Who is that, Amy? And a second?
A second.
Okay, from Jeff. So a motion from Amy and a second from Jeff. So Mr. Batchelor, do you want to recap, or would you like me to? How do you want to handle this one?
I can just quickly recap. We've heard resoundingly from community. I've heard from individual board members. One of the things that, individual discussions over the weekend, concerns over the confusion of, with kids of, masked and face shield and when, and let's just keep them masked at all times. My emphasis, the administration emphasis, we are trying to, figure out how we provide that option to bring our kids back to school. How do we do it safely? If this change helps that, we are recommending we make that change. We also heard, and I do want to be clear about this, that, we also heard from the discussion with Dr. Rubin and Dr. Brennan that our thinking was actually creative and something that, is worthy of looking into, that the idea of using a face shield potentially once at 6 feet or greater. So we're not at that point as a district or a community to look at that. So we're saying adjust it and remove, let's not do it. But there certainly are studies out there that show that can support the face shield. There are certain other studies out there as well that would show that for learning, again, looking at those options. But I think it's best at this point, we move away from it. So that's our recommendation, and that we adjust so that students are required to have their mask on at all times.
Okay, so, I don't know if we want to open to any board comment, or I think there's one or two quick questions here. Amy, did you have a question about this?
Yes, I did. I just wanted to ask if there's a way this would be a carve out potentially, like we already have written into the health and safety plan, for students with IEPs who might need an accommodation for this. That's already in the health and safety plan. And I imagine, for EL, there might be something that needs to be adjusted, like a clear mask or something like that. But I think that's already built into the plan, or no, Mr. Bechtold?
That is already built into the plan. So in the plan, they have a subsection that says that that students with IEPs or 504s, that the teams will meet to discuss possible accommodations based on disability.
Okay,
So
great.
This would not change that.
Okay, terrific. Thank you for saying that. And then my second question just is this concern over the gators. I know that has not been eliminated. I mean, I know it's part of the governor's order. This is new research. You might not be comfortable potentially with formalizing it as part of the resolution, but given the fact that this report has gone everywhere, could there be a recommendation potentially from the administration to stay away from gators for the time being based on the study that just came out as a form of a face covering?
Yes, and so I'll jump in there. So one of the things that we wrote into the plan was the ability for our principals to make determinations about the quality of the face masks or face shields that a student would use. And there's a specific example in there about a crocheted face mask. we felt that with this type of changing situation, there may be new things that come out. So we wanted to give ourselves the ability, if it came out 3 weeks down the road, that only N95s should be used, that we could have the principal saying that this is what it would be. So I think that as a district, as an administrative team, we'll go and continue to watch that. And then we have the ability to make determinations if we, at a later date, if it's deemed that is not permissible. And we did talk about the Duke study today. And so that was a topic of discussion among the administrators.
And my last question is there any reason why for a mask break that teachers couldn't take, I'm thinking of the younger kids in particular, take the students outside for a little bit to have a break if a break is needed?
I know Mr. Dukevich can jump in. I know we've been talking about this. Go ahead, Sean.
I was just going to say, absolutely, that's a great option. In 2.5 hours, there's not going to be a ton of time for recess, of course, but teachers certainly could take their class outside and do instruction outside.
Thank you.
Okay, and then Andrew, I know you had a question, and it looks like Nancy has one as well. Yes, Andrew.
Sure, just a quick question. So voting to approve the wording along the lines of recommendation does not have any bearing on the previous vote on whether we approved or disapproved of the health and safety plan. Is that correct?
Right.
In other words, we're just saying if you're in phase 1 or in phase 2, i.e. you're in a district building or on district property, you have to wear a mask. Is that more or less?
Well, we're just making a change to the plan that's already been approved. And so there's a spot in the plan where it says that if you're seated at a desk, you can take off your mask and you can put on a shield. And now that's going to be updated to say, when you're seated at a desk, even if it's 6 feet away, you have to still wear your mask. Is that accurate, Mr. Bechtold and Mr. Dukevich and Mr. Batchelor?
Yes.
There's literally a spot in the plan where there was an option to take it off. And now that will be replaced with the language that says you have to keep it on.
Yes, and actually that area was for at a desk, 6 feet apart. It was for recess, it was for physical education, and it was for lunch. And so those will be, that will be removed.
Right. Now, I don't know how you eat lunch without taking off your mask, but
Right. Okay, thanks for your clarification.
Great. And then Nancy, you had a question.
Can I have a comment? It's not so much a question.
Sure. Oh, yeah, sure. Go ahead.
I'm in support of this, given some of the trends we've been seeing in the area. And no, I'm not a healthcare professional, so I am not one to necessarily dictate this. It's a challenging position, but I would like to throw out the option that we continue to look at this health and safety plan so that if the trending or our positivity rates, incident levels are low and consistently low, that we revisit this, because I do think wearing a mask all day can be very tiresome, very difficult for people. I think mask breaks, if there's an opportunity, even in secondary, to go outside, because they'll be the ones that are there all day. I'm in favor of doing this now, but I think I would like to kind of have the flexibility of revisiting this as we continue to monitor the trends. And if we start seeing better trends, that we can talk about it again.
I don't know if other people have comment. I just want to give a point of clarity, and Mr. Batchelor, correct me if I'm wrong, but we will be looking at this health and safety plan all year long. And there will be potential for changes, I would imagine, all year long, potential.
Yes, just like the guidance from the health department is going to continue to evolve and change. With that guidance, we're going to continue to evolve and change. What's going on in the community, what we experience, whether we have cases, whether we don't have cases, whether we're virtual, all those factors will adjust our plan moving forward. What happens in society is, in our community and outside of our community is going to adjust that plan. So it will become a very living document that will continue to evolve and change.
Right, okay. Do we have other board comment about the motion? All righty, I will call the vote then. All those in favor of this motion as written, please raise your hands and say aye. All those opposed? The motion passes 9-0. Okay, great. So moving into new business, we do have we have an item that I need to, hold on a second, I just have to get back to my, sorry. Having trouble getting out of my full screen. All right, so we have an item of new business. I'd like to entertain a motion. I have to get the wording, so I apologize. To ratify the district has hired Dr. Joseph McNamara to be our new assistant principal at Radnor High School. And I'll give a little background about him in a minute. And in the June board meeting, business meeting, Mr. Batchelor, we passed an item where we gave the administration approval, authorization to make summer hires, to hire people over the summer, not new positions, but to fill positions. And we had a position at
It wasn't a June meeting, but it's a standing resolution we have. It's a standing
resolution. So, they were authorized to make a hire over the summer to replace the principal up at the high school. Mr. Brett Thomas has been named the assistant principal at Wayne Elementary. So that opened up a position at the high school. They had a search, and we are going to tonight, I would entertain a motion to ratify the administration's decision to hire Dr. Joseph McNamara as the assistant principal at the high school. He is joining us from Coatesville Area School District. He's been an assistant principal at the Coatesville Intermediate High School since January of 2013. He has earned his doctorate from Immaculata in May of 2020. And this item would normally be on the agenda. His salary will be $124,658.69, which is the same salary as the other Radnor High School assistant principals. So with that, I would entertain a motion.
So moved.
And a second. Sarah's a second. I don't know if we want any board discussion. I'd like to welcome Dr. McNamara. Ken, do you have we haven't met him yet. We look forward to meeting him. Do you have something nice to say about him?
No, I don't like to say anything nice about any of the administrative team. No, we are thrilled that he is joining us. I first off want to thank the high school and the staff for the thorough search that they completed. It was, we had a strong candidate pool. And thank Mrs. Kevgis for all that she did to find what we believe is a really wonderful fit for the high school. And Dr. Mack, as he goes by, Dr. Mack came today, met the administrative team, took time to swing by and meet us for the retreat today. So we're absolutely thrilled that we have his skill set, his experience, his temperament, with us in Radnor, and not only is going to prove to be an asset, but we're excited that what he's going to, bring to us as we move forward. So welcome, Dr. Mack.
Great. All right. So with that, I'll call the vote. All those in favor, if you could raise your hands, and the motion passes 9-0. Great. So welcome, Dr. McNamara. All righty. I can move into board announcements. It sounds like, Mr. Batchelor, we are going to have another special board meeting next week.
Susan?
You didn't ask if there was new business.
I wanted to make a motion under new business.
Oh, okay.
Okay. And, I'm not going to take too much time here, but, it's my opinion, and it's a respectful disagreement. I think everyone's been working hard here to make the best decisions. I think everyone has had the safety of the kids and the staff in mind in our district, but I guess, this is a rhetorical question.
Andrew, I'm sorry. If you could just start with the motion and get a second, and then you can talk about the discussion about it.
Okay. All right.
Thanks.
Yep. So I'd like to make a motion to vote on going all virtual tonight. And so we'd make, the motion would be, let's move to phase 3. And so I'd like to know if anyone would second that motion.
I second that.
Okay, so you have a motion and a second to move to phase 3 for the start of the school year.
Okay.
Proceed with your comments. Thanks.
Sure. Thanks. I appreciate that correction. So, where I'm coming from is that, and you can go back at the meetings on the 21st of July and the 28th of July, and you can look at the comments that I made. My point in making some back of the envelope metrics as a start of a conversation was trying to fill a void that Ken has talked about. Ken has talked about how there has been, some shifting guidance or perhaps sometimes a lack of guidance. And so I think what I was trying to do was to provide some kind of discussion and, put some numbers out there, see where we go. I was being very conservative with my numbers. So rather than 5%, I was thinking 2.5% local infection rate. And, I was thinking about the 7-day rolling average of new cases. And I was saying at that time, it was 850 on the 21st. On the 28th, it was 950. Right now, it's maybe in the 700s. We're looking better over the past couple of weeks, which is great. But I also compared it to a lot of Western European countries that have been in the 200s, so 250, 220, et cetera. And I was thinking to myself, why don't we make some, just again, back of the envelope guidelines of around 200 new cases rolling average per week for 7 days, and a 2.5 local infection rate, something like that, just to kind of get things going. And it was very interesting tonight to hear Dr. Rubin and Dr. Brennan kind of mentioned something along those lines. And the idea is to give those numbers to an actual expert, not an armchair, consumer of research like me, but to an actual expert to see what they would think about that. And so I was heartened to see that just yesterday, as Ken said, this is coming kind of thick and fast. I was heartened to see that there were some guidelines, but you'll notice that we're 70 something, it's not too far from 100. That's on the high end of the moderate range. And 5.2 is above that local infection rate. Further, in that moderate range, we have the choice to either go hybrid or online, right? So the door is open for us right now to go online. And I suppose that, again, with all due respect, we all work respectfully together. I just want to say, and then I'll wrap up. I don't feel comfortable with a kind of experiment on our kids, a kind of natural experiment. Here, let's try this for a couple weeks, see how it goes. I guess I personally am not comfortable with that. And the final point would be that until the numbers go down, and again, I know I'm on the conservative end of things, but until the numbers go much farther down, I am not comfortable implementing any of the wonderful plans that our administration has come up with. I mean, as a side note, I've been working on the curriculum committee with Lydia, with Dan and Sean, PT et al. They've been doing an unbelievable job of coming up with really good, safe measures to get kids back in schools, okay? I guess my first goal is not to get kids back in schools, actually. My goal is for kids to be safe. Pursuant to Amy's point, we have to make sure that while kids are learning online, that we are attending to their social, emotional, psychological, emotional needs. So that is an issue. So those are my comments. And I would just like to kind of move on to any other discussion.
Okay, would anyone else? Nancy, then Bradley, then Lydia?
I actually would like to I would like more time to really mull over a lot of the information that we heard tonight. So I'd like to make a move to postpone this discussion until August 18th.
I think that's a motion to table, and I would second that.
It could be a motion to table or a motion to postpone, but
Yeah.
if you put forth a motion, Nancy, you have to decide which motion you want, because then Sarah has to decide if she wants to second it. So postponing is a motion to postpone to a certain date. A motion to table just kind of says we have other pressing business and we need to move on. So if you want a motion to postpone to a set date, then that would be a motion to postpone. Nancy,
I think it's a motion to postpone to August 18th.
got it. And we have a second on that. So what I can't remember, Mr. Christofko, is do motions to postpone, do they entertain discussion?
You have to, yeah, there's a
I have a
discussion.
motion and a second to postpone.
There's a second to that. So now we have to vote on that motion before we move on, but I'll let Mr. Christofko chime
Yeah,
in.
I can't remember if we have to talk about a motion to postpone.
Yeah, this is procedurally the same as a motion to table. There's no debate. It's just a vote on it, up or down, and then you move on.
Great. So with a motion to postpone to next week, with a motion and a second, all those in favor? 1, 2, 3, 4, 1, 2, 3, 4, 5. The motion passes 6-3. So we will take this conversation up next Tuesday. And Andrew, thank you. I mean, I think you gave us a lot. I'm glad you had a motion and you had an opportunity to speak, because I know that those are the things that have been really weighing on you. And I think you shared it very eloquently. I just want to say. All righty. Do we have any other new business tonight? We do not. Okay, so with that, we have board announcements. For everyone who's still watching, we will have a special board meeting. Well, actually, I think I'm not sure about the curriculum committee meeting that will be scheduled for next Tuesday, August 18th, and that was set to be a virtual board meeting. We do have a special board meeting to conduct facilities committee business, and that was scheduled to be at 6:30, August 18th, and that was going to be a virtual business meeting. And then our regular business meeting is set for Tuesday, August 25th, and that's a virtual meeting. So, Mr. Batchel, I'm thinking perhaps we will be re-advertising our special board meetings for next Tuesday, the 18th.
Yeah, could we make a suggestion? Could we, so we have a facilities committee meeting set, the facilities is set for 6:30, and we're going to cancel curriculum.
Okay.
Why don't we have facilities at 5 o'clock and do the facilities meeting at 5 o'clock and then plan our special meeting at 7 o'clock. Would that make
We'll
sense?
be advertising 2 different special board meetings next Tuesday.
Correct. We'll advertise
We
2
can
special.
coordinate them and have 2 separate business.
We'll keep them separate. We'll keep one be a focused special board meeting on to conduct the work of the facilities committee with the entire board. The second meeting will be then to continue this conversation to discuss reopening of Radnor and the fall plans.
Okay, great. And then we'll have our regular business meeting on August 25th. So we will see everybody once again next week. Thank you all. I would entertain a motion to adjourn.
So moved.
Moved by Nancy, seconded by Sarah. All those in favor? Okay, motion passes 9-0. We are adjourned. Thank you, everyone, and good night.